Check out these sick beats. Can you hear me now? Okay, good. So I looked into it, and I can now confirm that yes, one of the people who worked on Persona worked on the music for this game. Several of the people who worked on the music for Persona worked on the music for this game. It's so good. Hi Lop, hi Homu, hi Chris. Everybody, that's Anadorks Chris. That's my sibling and co-host of Anadorks. Yo! So we're here today to do some surgery, because I can't not play this game. I love this game so much. I played this game so— the Lord's work! I'm doing the Lord's work! You were listening to Anadorks? Thank you, love! Nice. You will be confused. I am the same person and also not the same person. I am girl but Birb. Much like Tobias is boy but Birb. Alright. Let's get into it. Let's do it. So this is Hope Hospital, located in the city of Angeles Bay. Since its inception, Hope has continuously served the community. One of the young doctors here is still in need of guidance. But because of his desire to help people, he strives to improve. Dr. Derek Stiles will soon realize his full potential. Sure, we'll save. Save over my test file. Chapter 1. Dr. Derek Stiles. Story 1-1. Standard procedure. Hope Hospital, consultation room. We've been I can read. We've transported the patient to the pre-op area. Mary Fulton, age 39, the hospital's veteran surgical assistant. She's kind and well-liked, but tends to ramble too much. That's rude. The injury is on his forearm, and he's still fully conscious. Blood test results should be back from the lab any minute. It looks worse than it is. He's not in any real danger. I guess he got lucky, huh? Dr. Greg Cassell, the head of the surgical department here. Nothing rattles him, but he's strict and expects perfection from others. You'll be operating, Derek. I will? Derek Stiles, age 26, a surgeon, and the story's main character. Da-da-da! He just completed his residency and accepted a position here. I was, just about to start my rounds, so... Worry about that later. You're not an intern anymore. Hurry up and prep the OR. This is a simple extraction. There's nothing to worry about. Just take your time. Stay calm. Keep it steady. You should be able to handle this on your own by now. I should? Let's begin the briefing. Alright, we got a chart here. We got a time limit of 5 minutes. Lacerations and foreign objects in upper right brachium. Requires removal of the foreign objects and suturing. We got Kevin Turk. He's 172.3 centimeters and 155.4 pounds. I'm just an intern. They don't even pay me. The patient, Kevin Turk, just arrived in an ambulance. He lost control of his motorcycle and crashed through a glass door. This is lucky if this is all that happened to him. His lacerations have begun to hemorrhage. There are glass fragments lodged near his right shoulder. Our cosmetic surgeon is out at a medical society meeting. What? He's a doctor. He should be here. But you should be able to handle the stitching, right? Yeah, I guess. There are 2 main objectives in this operation. Suture any lacerations. Extract fragments of glass from underneath the skin. Be thorough and try your best not to leave any scars. I guess I'll try. Okay, let's begin the operation. A doctor, honey. Let's begin the operation. We should start with those lacerations. Select the needle icon to suture his wounds. I'm gonna shift a little bit here, yeah. Follow zigzag pattern, like so. Cool! Good work. Of course, this is a basic surgery skill. Now, do the same thing to the other laceration.
Cool.
Well done. The lacerations are taken care of. Next, select the forceps. All right. Put it on the tray. Now extract the other one. All the visible glass has now been extracted. We need to take care of these smaller wounds now. Select the antibiotic gel. That's the one. Gently apply it to the wounds. That's good. It looks like you're starting to get the hang of it. I'm a doctor. Medicine has come a long way. This gel cures small cuts instantly. Oh yeah, by the way, this is the not so distant future of 2018. This is 2018, everybody. In the past, cure-all ointments were just gimmicks and scams, but somebody finally created a real one. Oops, I shouldn't be talking so much. Let's continue. Some glass shards are embedded in the patient's arm as well. We'll need to extract those. Make an incision into the upper epithelium. Don't forget to disinfect the area beforehand, idiot. Now we'll make an incision. Touch the scalpel icon. There's no reason to be nervous. I'm nervous because you're looking at me. Cool. This is serious. We can't let them get infected. Why didn't we go... Hi, Punk! Hi, Punk! Yes, I am doctor today. Why didn't we go in through one of the open... Like, why did we seal him up just to cut him up again? I'm a little confused. We'll need to work quickly using the same procedure as before. Well done, Dr. Styles. Hell yeah. Why was that one just good? That one should have been cool. Everything looks good. Let's close it up. Suture the wound the same way you have before. Make sure the stitches aren't too wide or too narrow. Yeah, those are naturally occurring glass shards. Disinfect the sutured area with antibiotic gel. Heal up nicely. We apply the bandage. I looked up a guide on why I sucked at this, so this should go well this time. Oh, I nailed it. Make sure you review what we went over today. With what? The next patient that comes in? Do you want me to start planning crashes? Alright, alright. Alright. Rank? See? I fucking killed it! What are you talking about? I did great! See? You're catching on. That wasn't so hard, was it? I couldn't have done it without my lovely assistant. Alright, walk it back. Sekoharada. I definitely see improvement, but flirting isn't everything, right? Seriously though, keep practicing and you'll do just fine. C for certified, that's right. C's get degrees. Story 1-2, standard procedure 2. C for cool. Judging by the MRI, the tumor is isolated in his stomach. Okay, no intro. We just switch in patients, I guess. It's benign, but you should be prepared for anything. Any questions, Dr. Styles? Yeah, when's lunch? I mean, what? Yeah, I'm fine. Thanks anyway. Are you even listening? He is not. I know you're stressed, but this happens to be your job. Yeah, I'm stressed because it's my job. I'm responsible for lives here. Are you getting enough sleep? No, strictly not. You need at least 6 hours a night. That's enough. That's not enough. This lady is crazy. Don't you remember med school? I just finished my residency, girl. The patients depend on you. Derek, don't forget our follow-up with Mr. Jenkins this afternoon. Have you read the report? I haven't, actually. He got his AirPods in. You need to shape up. This is real life. You've been here 3 years, Derek. Get it together. You're 26. You've been here 3 years. You should have everything under control. We shouldn't still be babysitting you. Maybe we need to open an investigation? That seems like a wild jump. Dr. Styles is impaired medical and social development. Harsh. Cut me some slack, Mary. You're not a resident doctor anymore, Styles. You know that. Oh, did we skip time? Did 3 years actually just go by and I didn't notice? Oh, Mary. I spoke with Dr. Hoffman. Oh, I guess that wasn't like a sad but affectionate. That was, oh, Mary, I spoke with Dr. Hoffman. Thank you very much. Wait, you spoke with the director? About what? Don't worry, it's none of your fucking business. It's a personal matter. Just forget about it. Are you going on vacation or something? I wouldn't mind a nice long cruise myself. Sun, the sea. Okay, that's enough. Let's get back to this man with a tumor that we were discussing initially. Surface of the stomach should be removed before it becomes malignant. No alluring. Alright. Today, we need to excise a tumor in the distal stomach. In tests from 2 years ago, it was small and benign. However, it's grown rapidly and started to hemorrhage. That's not fucking good. At this rate, it might become malignant. After talking with Mr. Laurie, we've decided to remove it. There's one objective in this operation. Excise and remove a tumor from the distal stomach. That is all. But you'll need to use the Powell procedure to remove the tumor. Just like I learned in med school, am I right? First, drain the tumor's cytoplasm to decrease its size. Okay. Then, when you excise it, the cells can't metastasize, resulting in a smaller incision. There seems to be a trend toward this type of removal. It's a good idea for you to learn it. I've never learned it before? You're making me try something I've never done? Now begin the operation. Work quickly, but stay calm. Understood. Let's begin the operation. This music is so sick. This will be a laparotomy. You'll need to open up his abdomen. You've done this before, so remember to stay calm. Let's begin. Disinfect the area and make your incision. I'm no rookie doctor, if you know what I mean. Why did his vitals just fucking tank? I guess I did cut him open. We're going to treat a tumor, but... his vitals are... well, spotted. Select the syringe on your right. We need to stabilize his condition. Touch the bottle. Slide it upward. Touch any part of the infected area. I don't know if it's infected. Vitals are stabilized. Now we can begin. At first glance, it looks like nothing is wrong. However, yesterday's test revealed something in the lower stomach. We'll need to use the ultrasound, the instrument in the upper right. Try it. When you find the area, there will be a shadow. Oh my god, I fucking nailed it. I'm so good. You found it on your first try. Is that talent or beginner's luck? Now we expose the tumor. Incise down the center. Ew. It's pretty big. Looks like we did this just in time. As Dr. Casal explained, we'll be using the Powell procedure. We'll drain it first. Pick it up. Now insert the drain into the tumor. Now slide along the tube. Hell yeah, we've completed. That was fast. She trying to be mean? I don't know if she's trying, but she's fucking succeeding. She's undermining my authority. Cytoplasm will continue to ooze out if we don't do anything. Excise it with the scalpel before that happens. Extract it. Put it on our cute little tray so we can take it home. Removing the tumor is only the beginning. Grab a membrane with the forceps. That's good. Now let's affix the synthetic membrane. First, apply antibiotic gel over the membrane to disinfect it. That's enough fucking gel, dude. The membrane is beginning to meld with the tissue. It's made of protein, so there's no chance it will be rejected. That's good. Give it a gentle massage. Oh, I forgot about the massage. Hell yeah. Now finish the operation by suturing the incision. Cool. Alright, and now we're not gonna fuck this up. Fucking nailed it. You can relax now, Dr. Stiles. The operation is complete. Hell yeah. Okay. Seems like a good score. Okay! Senior surgeon! Yeah, I fucking get yes! I'm doing better. I'm making strides every day. Nice work, Derek. It seems you value accuracy over speed. That feels like a backhanded compliment. Just remember that the patient's safety always comes first. You're getting better every day. Keep up the good work. Save the game. Episode 3, A Farewell. Who's gonna die? Hope Hospital, nurse's station. And so, since my husband's been relocated to a different office— oh no, Mary! I'll be leaving Hope Hospital, effective immediately. She's just gonna walk out the door. I'm really going to miss this place, and all of you. But I promise to continue my work as a nurse, wherever life takes me. You all taught me that helping patients is its own reward. It was a pleasure to have you on staff, Mary. Good luck with the new job. I can't believe you're leaving. This is all so sudden. What are you going to do without her, Derek? Wait. No, I stand by that reading. Actually, Derek's the only reason I'm a little hesitant to leave. I even spoke with my husband about it. I was like, can you not take this promotion because this stupid fucking doctor where I work needs my help? I told him there was a kid here that depends on me. Who depends on me, actually. It would be who depends on me, but I see you went to nurse's school, not English school, so, you know. He asked me how long I'd been working at a pediatrician's. Alright. Come on, I'm not that bad. Is Mrs. Fulton still here? Oh, hello, Dr. Hoffman. I'm not interrupting anything, am I? Robert Hoffman, age 62, the director and founder of Hope Hospital. He used to be a renowned surgeon, but works in management now. They always do. They always take that buyout. No, of course not. I came to say goodbye, since I won't be around tomorrow. Thank you for your many years of dedicated service. You're a fantastic nurse. Probably our best. On behalf of our entire staff, I'd like to say thank you. Oh, sir, the pleasure was mine. I wish there was some way I could thank you for this opportunity. Well, you're not going to stop nursing, are you? If you continue to help people, that will be thanks enough. Of course, sir. Helping people is my life. It's just, I wish I could stay and learn from you a little longer. Don't be modest. You already know everything I have to teach. I'm afraid Dr. Casal surpassed me as a surgeon long ago. Dr. Hoffman. Good luck with your new job. Don't be a stranger, okay? Oh, ho, ho, ho. Looks like Santa. With glasses. Well, I have matters to attend to if you'll excuse me. I'd hoped to see Dr. Hoffman in action more often, but he stopped operating on patients after that incident. Derek, let's discuss the next patient. Yes, sir. This is my last operation here. Don't let me down, Derek. Yesterday's operation went very smoothly. I want you to handle Mr. Spence's operation today. It's another tumor excision. Just be careful. There's more than one this time. Don't overlook any. Multiple tumors confirmed in the pancreas. They may lead to a loss of stamina, so immediate removal is necessary. This is the last time I'll be assisting you, Dr. Stiles. If you can handle this operation, I'll feel much better about leaving. Well, bitch. Oh, I didn't mean to upset you. But wake up, Dr. Stiles. There's only one person you should be thinking about during an operation, and that's the patient. Do you understand? Yes, ma'am. Let's review the main objective of today's operation. Excise and remove all tumors from the pancreas. Now think back to yesterday's procedure and begin. Here goes. Let's begin the operation. Let's begin. She's not even telling me what to do anymore. She really trusts me.
Doctor?
Oh, it's inflamed. We'll need anti-inflammatory. Just jam those NSAIDs in there. Oh, not enough for that one.
Doctor?
Good, the swelling's gone down. Let's move on to the tumors. They're in the pancreas somewhere. Oh! Got one. Hell yeah. Now we rub it in. Alright, now we gotta find another tumor. Ah! Gotcha, bitch. My drain got a little clogged there. Good work, Derek. You didn't even have to ask me what to do. Of course I didn't. I'm a doctor. Alright, we're gonna pop his vitals up a little bit. Keep those nice and high. Hi, Yusha! My zappy laser! Alright, oh no, I don't get a laser till the next- oh wait, this is a laser. Oh god, I created several small burns. Don't worry about that. You just needed- I killed the aliens. It's fine. The zappy laser wasn't for this procedure, apparently. All 3 tumors have been excised. I'm really improving. Like, that moment where I just, you know, I just zapped him for no reason. You seem really focused today. I guess my work here is done. Perfect work, Dr. Styles. Let's close up the incision. I forgot there is, in fact, moments where I have to use the laser in this game. I thought it was only in the next game. Operation successful. How'd we do? Not great, I don't think. Yep. It might have been not getting the ultrasounds on the first try. It might have been when I burned him several times with the laser. We will never know for sure. You did a great job, Derek. You have nothing to worry about. I can tell that you'll make an excellent surgeon. Please continue using your abilities to help the people of Angeles Bay. Nurse Angie. Okay, so she's a bit of a Taka face in this game, a bit of a Takamura Takako face. She's a bit of a Tsun. So, yeah, Nurse Takako is on the way. And so, we all feel you deserve a gift of appreciation. Thank you for your 18 years of service, Mrs. Fulton. Thank you so much. I'm a little embarrassed. Mrs. Fulton was more than a great nurse. She looked after us as well. She will be missed. Are you sure you're not glad to be free of my nagging? I am. What are you talking about? I'm worried Derek will start coming to work late again. That's not a good thing for a doctor to do. You're the one who kept him in line, Mary. Ah, jeez. Aw, jeez. I'm standing right here, guys. You don't need to worry. I'll be fine without Mary's help. I may be young, but I'm still a doctor. That's good to hear. So, no more sobbing phone calls from you, huh? What? You're... What? I wasn't crying! I'm just teasing, Derek. You've grown so much since you joined us, and I'm proud of you. Work hard and you'll surpass even Dr. Casal one day. I believe in you. Aw, thank you. Other nurse. She's not here yet. She called in about an emergency. That's all she said. Is something wrong? They must be talking about my replacement. Since I'm leaving, she's going to be your new assistant. I was supposed to train her this afternoon, but HR said she was very reliable. I hope everything's okay. Sorry I'm late! There she fucking is. The DS. With the space in between on the original DS, this looked a lot better. This looks pretty weird like this. I'm Angie Thompson, the new nurse. I'll be starting here tomorrow. Angie Thompson, age 21, Hope Hospital's newest employee. Angie is part German, born into a very well-educated family. I guess that made more sense when this game was set in Japan. Like, why they felt they had to explain why she was blonde, but once they moved it to America, it doesn't make a lot of sense that they're like, we have to explain why she's blonde. She also has an international nursing license. Is Mary Fulton here? I'm ready to go over protocol now. It's very nice to meet you. Wow, she's a nurse? Isn't she a little too... What are you gonna say? Young? A little too hubba hubba? A little too awooga? What's that now? Oh, I forgot she had such a little cute little chubby face in this. They changed the art completely after this game. This is the only time these characters will look like this. Well, no, nothing, pardon me. I was on my way here when a man on the bus suffered a heart attack. I took him to a nearby emergency room and helped with the procedure. Of course, the paperwork took forever to fill out, so yeah. Sounds like you had a rough morning. Well, don't you worry about being late. I completely understand. Excuse me, is Miss Thompson here? There's someone on the line from St. Francis Hospital. Thanks, I'll be right there. Please excuse me. Hi, She's certainly something. It sounds like she knows her stuff. What do you think, Derek? What do I think? You don't want to know what I think. The HR doesn't want to know what I think. Singing the blues. Oh, I remember. I played this. I loved this operation as a kid. I played it a bajillion times. Good morning. Hello, Dr. Stiles. You were supposed to be here 15 minutes ago. Your patients shouldn't have to wait just because you're behind schedule. I'm sorry? Anyway, I'll call in the first one. Man, she's strict. Please have a seat, Mr. Cox. Yo, Doc. During today's surgery, we'll be removing the polyp in your throat. How are you feeling? It's important for us to know about any changes to your condition. If anything's wrong, it could cause problems. I really don't know. Huh? I've been doing concerts for 7 years while working part-time. I'm still cutting out. Try leaning away when I greet people. Okay, I can do that. I can do that. I can also just do this. Alright, we'll see if that helps. So I finally land a contract with a big record producer, and my throat's screwed up. What if something does go wrong? I lose my dream forever, all because of this polyp thing? Well, we're just gonna try to do our best. Just relax, okay? You're gonna try? I always tried my best. I practiced late, stayed in shape. But if that's all I needed, I would have had a contract years ago. It takes a lot more than trying to write a hit single. Come on, try to stay positive. I'm sure you'll be alright, really. Dex, Nate, Tisha, you fronted the money for this operation and I let you down. It doesn't look like I'll be able to pay you back, guys. I need to take your blood pressure, Mr. Cox. This way, please. She's like, none of that bullshit. Yeah, whatever. Why didn't you just tell him everything would be fine? Wait, what? Didn't you read your own note? He's completely nervous. Our job is about more than just treating illnesses. Proper bedside manner is essential to a patient's recovery. Things you say directly affect these people's attitudes. Don't you get it? Yeah, I do. I hope you're a little more serious during surgery this afternoon. I love her so much. We should start the briefing. Let's review today's patient, Mr. Cox. He started feeling pain in his throat about a month ago. He's been coughing up blood since then, and now has trouble breathing. Since Mr. Cox is a rock singer, it's likely that a polyp is formed. We don't even know for sure. We're just going in. There's no trauma dumping in the hospital. I'm trying to fix you. Because of the strained bronchial tubes, obviously it is now hemorrhaging. We tried a nebulizer treatment, but his condition is getting worse. It's not life-threatening, but considering the patient's career, it's serious enough to warrant a surgical intervention. It's still possible for him to recover completely. What's your opinion, Dr. Casal? That sounds like a good plan. Are you ready, Dr. Stiles? This operation has 3 objectives. Drain the overflowing blood. Locate the problem area. Use the laser to remove it. Oh my god, I use a laser now. I'm so excited. This is a delicate operation, so we'll need the magnification tool. Remember to treat the patient very carefully. Nice work, Angie. Derek, good luck. Okay, let's begin the operation.
Let's begin.
Operating on the pharynx requires precision and the utmost care.
Dr. Stiles?
The outer membrane of the trachea has started to hemorrhage. That should be our focal point. It's hard to see the affected area, so we'll need to magnify it. Select the magnifier from the top right. This used to be the ultrasound. What? What is wrong with my circle?
Dr. Stiles?
Okay. That hemorrhage is our problem. Once you're finished working, draw another small circle to return to normal magnification. Keep these options in mind to set up the best angle for any given task. First, we need to drain the blood. The source of the bleeding seems to be a small group of polyps. There's no way we can excise them. They're too small. Use the laser. The laser will continue to burn until you lift it away, but applying it for too long may cause additional bleeding. Please be careful to precisely apply the laser only where necessary. Let's begin.
Dr. Stiles?
I don't think it's possible to burn away the polyps without damaging nearby tissue. The capillaries in the trachea's outer membrane are damaged and have caused further bleeding. You're going to need to adjust the procedure accordingly. We'll need to apply antibiotic gel immediately after using the laser. Blood starts to collect, drain it quickly to maintain visibility. Stay calm, Dr. Stiles. If you're careful, everything should be fine. Haha! Beat you to it. Could have gone better, but I guess it's not bad for you.
Stiles?
Oh my god. Why is this the one thing I can't do? Does it want it to be this direction? Oh my god. Okay, circles is apparently a problem for me. Yeah, Mike, I love this game. I played it a lot on long car rides. We'll need to treat all of the polyps. Okay. Don't you fucking bleed. Those vitals are getting a little low. Just jab that in there. Any old place. It fucking hates my circles. That's right. Oh my god. Okay, got a little blood. It's okay. Oh no, I fucking suck, dude. I fucking suck. It's everywhere. Alright, calm down, dude. Circle minimize, big circle maximize. I don't know. I love the touchscreen. I'm playing this on my tablet, actually. But I loved the touchscreen. And one of the reasons this was one of my favorite games is that, like, I felt like it was one of the games that made the best use of the touchscreen. There we go. Getting better at circles. You'd think I'd have mastered him in kindergarten. Oh, I remember the trick. That's the strat. That's the strat. I remember the strat. The strat is you apply the antibiotic gel first, and then they fucking heal themselves. Oh, that's still the laser. That's still the laser. That seems to be all of them. Let's close the patient up.
Dr. Stiles?
Cool. So I've really been assigned to this inexperienced guy. That is good job, Dr. Stiles. I love you, Angie. Rank A, hell yeah. You know, for not playing this for years, I'm doing all right. I'm doing all right. Well, Mr. Cox, your operation was a complete success. Don't try to speak yet. Your throat still needs to rest a little. Don't worry, though. In a few days, your voice will be good as new. Maybe you could hook me up with tickets to your concert? I'm a doctor, but I'm poor. I spend all my money on anime figurines. Oh yeah, what was that, Angie? I'm so inexperienced, but I'm a senior surgeon. Get wrecked. Thank you so much, doctor. Take care now. Well, that looks like the last walk-in for today. Angie, let's begin pre-op at around 1 o'clock, okay? Don't you think we should have examined him more carefully? There were signs of cyanosis, which could indicate asthma. If that's the case, he needs to see a physician right away. I am a physician. Really? I didn't think it was anything serious. You need to start acting like a real doctor, Mr. Styles. Mr. Styles? Mr. Styles? Takako type blonde. Correct. She is, yes, I'm a big fan of her little shitness. You're overreacting. I'm sure I'll be fine. Famous last words. Since Dr. Casal is at a press conference, I'll be briefing you today. I think you'd be briefing me even if he was here. We're extracting a stage 1 tumor from the small intestine. So if we take it out, the patient will fully recover. However, the blood test results were unusual. We can ask Dr. Casal about that once he gets back. If I extract the tumor, he should be fine. That's technically correct. The best kind of correct. Just because you're correct doesn't mean you're right. I'm pretty confident. I've extracted tumors several times already, actually. This'll be a snap. Okay. Keep the 2 operation objectives in mind, then. Treat the inflamed epithelium in his small intestine. Excise and remove all tumors in the small intestine. Incestin? We don't want that in there. If you're ready, let's begin. Let's begin the operation! Well, Dr. Styles, let's begin. First, let's jack those oh, they max at 80. He's a sick man. What is that? What's going on? The entire intestinal membrane is inflamed. What's going on? Only the small intestine should be affected. Doctor, I think we need to close up the patient and re-examine him. Let's continue operating, Angie. The symptoms aren't uncommon. I understand. In that case, proceed with tumor excision. I know you've done this before, so I'll try to stay out of your way. These are big fat oh fuck, inflamey boys. Treatment is going well. Please inject the anti-inflammatory. Treatment of the visibly inflamed areas is complete, but... First tumor's been excised. At least we're making progress. Alright, I could use a little bit more of a vote of confidence there, Angie. I don't think you need to actively shit on me during the surgery. I'm already up to my arms and intestines.
Dr. Styles?
Second tumor's been excised, but something's not right. We massage. Okay. Looks like we're doing great, Angie. I don't know what you're so worried about. Now, is there another tumor? There we go. We've removed all the tumors. Please treat the incision. We've treated the patient as planned, but he's not improving. Hi, Cronus! You're not late, you're right on time. You arrived exactly when you meant to. His vitals aren't stabilizing. There must be something else. The patient's vitals don't usually stabilize right after the operation. But we need to at least check his blood test results. Okay. What would you suggest? Try using the ultrasound again, just to be safe. Check the entire area carefully. I don't see anything, Angie. But I was certain Sorry for second-guessing you, Doctor. Don't worry, we're both still learning from experience, right? I guess. You should finish by suturing up the incision. Cronus, this is our tsundere nurse, who doesn't believe in us.
Work, Doctor.
We're finished, Dr. Stiles. No special bonus? No special bonus for me? I guess I sucked. I guess I do suck. Maybe she's right. Dr. Stiles. Oh, hey, Angie. Thanks for your help in there. I'd like to have a word with you about that last operation. Was there something wrong with my bedside manner? No, it's about the patient, actually. His white blood cell and globulin counts are rising rapidly. I also noticed inflammation along the patient's peritoneum. That's different than the perineum. It is different. Yeah, it's been a lot of years for me too. I was really excited when I realized I could play it again. We should re-examine him immediately and consult his regular doctor. I agree with you, but I'm afraid it'll have to wait for tomorrow. You've only seen since. She's still warming up to us. I'm supposed to help with the next symposium, so I'm meeting with some of the doctors from St. Francis's to learn the ropes and everything. My guy. What do you mean it'll have to wait until tomorrow? But these are very busy people, and I can't just blow them off. We'll do it first thing tomorrow, though, okay? I promise. But, nope. I left. We're on the city walk. Oh, too bad I have work tomorrow. I would have liked to talk a bit longer. Oh well, at least now I'm ready for that symposium thing. Oh, my cell phone. Dr. Stiles, where are you? The patient is in critical condition. Get back here. What? Taxi! Take me to Hope Hospital and step on it! Angie, a tumor metastasized behind his lungs, which began swelling. It festered, and 30 minutes ago the tumor ruptured. The patient is in shock and suffering acute peritonitis. The other doctors are operating on him as we speak. Follow me, Mr. Stiles. She's still not calling me fucking doctor. She's still not fucking calling me Dr. Stiles. Bitch, I love you. I am a doctor. I know you don't think I'm very good at it. You need to see the result of your carelessness. Ooh, sad music. Downpour. I understand you didn't have much information to base a decision on, and I do admit that the tumor was difficult to see from the x-ray. However, the laboratory left you several memos about the patient. I understand they pointed out his extremely high numbers. More than that, you dumped your responsibilities onto a nurse immediately following a very delicate operation. It wasn't... I mean... Miss Thompson, what are you... Please excuse me for interrupting, Dr. Hoffman. I understand this is a little rude, but I have to say something. What is it? It's about the negligent attitude Mr. Stiles has displayed thus far. I warned him about this patient at least 3 times, but he said that there were more important personal matters he had to take care of. Then he just walked out without another word. Mr. Stiles, maybe you didn't harm the patient directly, but how can I work under a doctor who doesn't even try to act like one? It doesn't matter how small or groundless a suspicion might be. The patients are depending on you to take care of them. Why did you become a doctor? Do you even know? You don't deserve to be here. Oh my God, you're not a real doctor! I'm gonna go get drunk. I really screwed up. I ignored that patient. I was trying my best. I didn't think it was anything serious. Hi, Nano! I am a doctor! But a patient almost died, and it was all my fault. Being called Dr. Stiles doesn't make me a good doctor. What was I thinking? I'm no doctor. Not if I keep making mistakes like that. Uh-oh, looks like rain. You can really tell this is the Atlas team, because this looks just like the Persona 2 and like the Devil Summoner and Soul Hackers maps from the time. Hurry up, you two. We need to get all our displays inside. Rain. Maybe that'll help me calm down. Maybe then I'll feel better. Sir, it looks like you're completely soaked. Did you come from a hospital? You might want to head back soon. That's a weird place to put an apostrophe. They don't want me there. I'm apparently useless as a doctor anyway. You don't need to dump this on her. She's just trying to be polite. You wish Nara was your doctor, beating you into the atmosphere with a single punch. That would be a preferable way to be put under. Hey, yeah, it's me. You'll never believe this. Huh? We can guess if you want. Nope, it's even better. There was this crazy accident with a truck and an SUV. It was nuts. This is better? You're excited because you saw an accident? The drivers flew into the street and... Huh? I am not messed up. An accident. We usually handle emergencies, but Dr. Casal's out of town. That means there aren't any emergency doctors on call. That seems like a problem. Save the game. The City Walk. Welcome to City Walk. She's absolutely messed up. I didn't realize that as a kid. I don't remember that line. So I directed them here. Where are the patients now? Where were the accident victims taken, Angie? Dr. Stiles, the patient, he was suffering cardiac arrest and I couldn't resuscitate him. The other nurses are busy and with Dr. Casal gone, I can't. What am I supposed to do? The patient's going to die, but I can't even. Calm down. Take me to the OR. Okay. What's the situation? After the accident, the ambulance brought him here. His heart isn't beating. I tried reviving him, but Angie, what do I do? I need help. Angie! Dr. Stiles. The only person here who needs help is the patient. And we're the ones who are going to help him. It's up to us and only us. We're going to save him. I can't do this without you, Angie. I want to save his life. Pretend this is a normal procedure. Calm down. Think things through. First, we need a pulse. We have to get a pulse. Understood. Let's begin the operation. Oh, Jesus. He's flatlining. We have to do something. We need to recover his pulse. Apply antibiotic gel to his chest area. Try massaging the heart. Cardiac massage. That's legit. That's real. There's a pulse. We did it. Vitals have reached low 30s, but he's not in the clear yet. Vitals have reached low 30s, but he's not in the clear yet. That sounds more like the Angie I know. Yeah, it is a pun on Stylus. I looked that up, actually. You are correct. His name is a pun on Stylus. Dr. Stiles, are we going to save him? Of course we are. Understood. First, treat the wounds that have started bleeding. Bad. Okay. I don't know why bad. We're just gonna... Treatment's going well. Please continue. God, this music's so good. External wounds have been healed. Hi, Memento! Thank you for stopping by. Bleeding seems to have stopped, but his vitals are dropping fast. He suffered a lot of damage to his chest. What else could it be? Perform a lobectomy. I think there might be something in his chest. No, you can't. Don't take this the wrong way. I don't think you have the skill to treat it like this. We recovered his pulse, so maybe we should leave the glass in his heart until Dr. Casal gets back? That seems like a stretch. No, the longer we wait, the lower his chances at survival. I don't know what to do. Either way, I won't blame you. This is your decision. I understand. I'll trust you. Be careful around the pericardium. We are fighting against blood loss. Oh, fuck. Careful, the smallest mistake could cost the patient his life. I know, I fucked up. No problems. Continue treatment. You were just yelling at me. Oh, there's some sort of graham cracker crumb on my screen that could kill the patient. Hang on. Okay. I know something about to happen next, so I'm gonna do that.
Vitals are critical.
We have a pulse! Oh, okay. Open heart surgery. What? It's like fucking Jaws. How could something like that be lodged in the pericardium? Please extract it, but be careful. This is gonna need some sutures. I think he's going to make it. This can't be happening! This is bad. Damn it, don't die on me!
Vitals dropping.
Come on, concentrate. All I have to do is suture this wound. What? He sutured the myocardium in a split second. Am I eating during surgery? No, I ate earlier. I think we're finished. Let's close him up. Yeah, Dr. Styles has magic. I could feel him slipping away. I was so scared, Doctor. I froze, and all I could think about was running away. But you didn't worry at all. You stood your ground and did what had to be done. You are a real doctor. Thank you. Dr. Styles, look at her little fucking anime face. I love this girl. I am a real doctor. Nurse, pass me the beer can hat filled with Soylent. That should be how doctors eat during an operation. Nurse, help me do this keg stand. I've never felt that way before. I'm starting to understand. His condition's stabilized. Let's keep an eye on him. Yes, doctor. We need to contact the other doctors, and I'm way ahead of you. Most of the off-duty doctors are coming in. I also called Dr. Casal. You're peeling yourself out of bed? I had to do that to get to this. You're energized? I know, right? Oh, I'm a little too loud. I'm gonna pull it back. Yeah, no, this game hypes me up, man. Good work, thank you. I think you should rest. That was a long surgery. Yeah, if it's okay, I think I will. Now I'm too quiet. I'll figure it out someday. This game is so good. Angie, yes? Everything you said this morning was true. But I'm going to stay here as a doctor. I'll try harder. I'll become a better surgeon and make you proud. This game has like a pretty small fan base. It is somewhat dedicated. This is a true story. Atlas puts out a survey every year about what properties you want to see. Somehow I missed Gaudy following. Thank you for the follow, Gaudy. I didn't see that. I don't know if the alert went off and I just didn't see it because I was zoned in. But every year I wrote in Trauma Center on properties I wanted to see more games of, and in the last couple years, it's been a checkbox item, so my work is paying off. We may see more Trauma Center someday. I'll become a better surgeon and make you proud. If that's the case, don't come to work late and don't leave without doing your paperwork. That is honestly, that is the bare minimum, actually. I'll do my best. Paperwork is not the part of being a doctor that you expect, I guess. I remember it being like niche popular in the anime community for sure, but it sold well enough that the sequels got brought here. But as a chronically late person, I don't think being a doctor would stop me from being late, if I'm honest. It's weird. I don't know. That one played. I don't know. Well, thank you for the follow, Gaudy. I appreciate that. Anyway, I'll do my best to do paperwork. And there's one other thing. Huh? please fix your hair before coming to the hospital? Oh, she's so cute. Sometimes it's embarrassing to work beside you. I'll be more careful. Oh, okay. I'm taking a nap. Wake me up if anything changes. I understand. Have a good rest. Dr. Styles. God, I'm so cool. Chapter 2! Right, I take sip. It was me, I guess, like, an hour and a half ago at this point that I was like, I guess I do have to get out of bed if I intend to stream. I was just, like, on TikTok. Dormant ability. What the heck happened during that operation? It almost felt like time was slowing down. Did I really do that? I knew exactly what to do, but I don't know how I knew that. Ugh, now I'm just confusing myself. Derek! Pay attention! Huh? I mean, I was. Stop daydreaming and start taking your job seriously. I'm sorry. We need to have a meeting about Mr. Pratt's operation. Angie, can you prep for that? Yes, of course, Doctor. Let's go over the procedure for Mr. Pratt's operation. Thrombi. He's been suffering from dizziness and nausea recently. Tests show that wastes accumulated in his spleen and are now blocking blood vessels. Oh god, I remember this operation. This one's kind of a bitch. Today's objective is to remove the buildup of thrombi. The contrast medium was administered 30 minutes ago in IV. Because of that, you should be able to find the waste using ultrasound. Once it shows a shadow, try clipping near that area with a forceps. It should stop moving. Make your incision, then drain the area. This is a sensitive operation, so you'll need the magnifier. So remember, the objective is remove all thrombi in the vessels. That is all. If further waste blockage occurs, the patient's vitals will drop. Remember to work quickly, but with precision. Let's begin the operation.
Let's begin.
These readings aren't good. Treat that spleen right away. I guess it just says the. That felt more appropriate. The contrast medium is working well. We've confirmed the problem area. Thrombi causing the vessel blockage are originating here. Work carefully. Use the magnifying glass to view the vessel area. Is it here? Yeah. Magnification successful. We barely magnified it. Please continue. We need to use the ultrasound to look at. Oh my god. Okay, so you want to stop them before they get to the thing. Oh, this is not gonna go well. Oh, we missed it. Oh god. Oh god. Please, please, all of you stop. Please stop. Please stop. We're fucked. We're so owned. I'm not a real doctor. I take back everything I said. Okay, so they just did a big wave at the beginning, I think, to show me that that could happen. Stop, you thrombus. Oh god, whatever the change in blood flow seems to be causing the suspended thrombi to move as well. Doctor, this is bad. This is really bad is what it is. We can't do this. Gotta work fast. Gotta concentrate. Oh, thank god. Thrombus, or throbbing rhombus, as it's known in the biz. Why can't I get these? What's a thrombus? I genuinely don't know. Haha, stopped you, fucker. And bump those vitals up a little bit. See, normally you have a limited amount of time with this ability, but in the first couple uses where he doesn't know how it works, it just goes forever. It's pretty great. Doctor, what are we... No thrombi detected. Treatment is complete. Suture the incision and the operation will be complete. Amazing work, Dr. Stiles. That was impressive. Hell yeah. We hate the throbbing rhombi. I do plan to continue the longest journey, or actually probably start it over at some point. I don't know when, though. $5,000 points in rank C? I think that's pretty fucked up. You might actually be a pretty good surgeon, Dr. Stiles. Huh? You were practically a different person in there. Just like yesterday. It did feel almost like I was someone else. If you were that focused more often, I wouldn't have to worry as much. Alright, come on. You can just give me a compliment. So you worry about me. I definitely worry about your patients. Angie, I'd like to review the footage of today's operation. Of course, sir. I'll bring it to you later. If my hunch is correct, then it should show up on the tape. I called you here today to warn you about something. Dr. Cassell tells me you may have potential for the healing touch. Healing touch? You don't know? No. Doctors with the healing touch can cure incurable diseases. They can even save patients who come within an inch of death. My voice for this guy is not consistent. I don't know how long this gift has existed, but the Greeks believed such doctors descended from Asclepius, I can speak. The god of medicine? Me? Those with the healing touch have certain special qualities. Why did they make this guy look older in the newer version? I don't know why they did anything they did in the newer version. They all look so completely wildly different. It's like they hired someone from a different studio. Like, the characters in the future games don't look anything like this. Uncanny judgment, perfect focus, and unmatched surgical skill. Haven't you noticed any changes during your operation? Sometimes, it starts to feel like time is moving much slower than normal. That must be a result of your extraordinary concentration. Yeah, he's only 62. Even here, I feel like they make him look really old. It definitely marks you as capable of the healing touch. So, I have all those powers? I'm a wizard? You need to forget about them. Those things are unnecessary. What? Then why are you fucking telling me about them, dude? If you pursue this, yes, you will become an unparalleled surgeon. But are you prepared for the pain that would bring you? Derek, a doctor's hands are heavy with responsibility. Patients depend on us, and they place their lives in our hands. Can you imagine how heavy your hands would be with the healing touch? There aren't many doctors who would endure such a weight. I'm only telling you this for your own good. Then don't tell me about it. Forget about that power and be a normal doctor. It's the only way for you to be happy. Heavy are the hands that wield the scalpel. Hi, Takao! For my own good. Think of it this way. Right now, you're standing in front of a door. If you continue to knock, the door will eventually open. But you could also turn your back on it, and it will stay closed. Why not stay away from surgery for a while? Take your mind off of it. But it's for your own good. Yeah, it's wild to me that the second, like, the Redux for the Wii was only, like, 2 years, or, like, even a year really after this. and they just totally changed the style. They did sort of, I guess the second Trauma Center DS game is closer to this style, but it's still not this. This is so, like, mid-2000s anime. It hurts, but it, like, in such a good way. What's wrong, Derek? Shouldn't you be checking on your patients? Dr. Cassell, do you think I should stop trying to improve as a doctor? You have the power to cure incurable diseases and reverse death, but maybe you shouldn't use that power because it might make you a little sad. Yeah, that is the vibe. So Hoffman spoke with you. I was hoping the news about your healing touch might motivate him to start operating again. Huh? Why would it do that? Back when the director was still operating on patients, he named that skill the healing touch and accepted its abilities. What? He has it too? But then something happened. He hasn't operated since. All because of one mistake. Can you imagine how heavy your hands would be? A single flap of a butterfly's wings. It does look weird once you get used to the Wii Games art. I do like the Wii Games art, but I really didn't like it at first because I was like, this is not the game I played. There aren't many doctors who could endure such a weight. Can I really do it? Can I master the healing touch? Well, I can't exactly relate. I don't have that ability. But I know that if you intend to use your power to help people, you need to take command of it. Take command? Yes, there's no halfway with something like this. One simple mistake changed the director's entire life. He delved too far into something even he couldn't understand. I think you can learn a lot from the director's past mistake. If you can control that power, then it's going to if you can't control that power, rather, then it's going to cost you. Do you think I can do it? Me? A spry, plucky anime protagonist? It seems like your skills involve focus, so concentrate on that. I'm sure you'll be able to figure it out for yourself once you adjust. I can't fully understand the healing touch because I'm not you. In the end, that's who you're going to have to rely on. Good luck, Derek. I need to focus on concentration. I remember Dad saying I could never concentrate on anything. Oh, our boy has ADHD and the healing touch. He told me to imagine one shape, like a star or something, and focus. I don't know where he learned that, but it really helped during exams. But then I just drew stars on everything. Maybe that would work. I'll imagine a star. If I can just relax, focus, and concentrate. Personal training exercise. Gain focus and practice superhuman concentration. I should be able to practice. First, I'll just recall what happened during that operation. Now I'll think about a star. Concentrate. Concentrate! Healing touch is just built-in Adderall dispenser. Yeah, everything slows down so you can handle it. Okay, I can do it. Let's begin the operation. Oh, I can't wait till I get to defuse the bomb. Healing touch. The power of Asclepius. I can do this. First, I'll recall the procedure. I'm looking at the patient. I was holding the scalpel like this, and then Okay, now I'll concentrate on my hands. These hands. These hands. This chair. I'll draw a star. Almost. I was close. I'll try again. My ears are burning. My nose is bleeding. He didn't say that. I need to treat the affected area. Okay, for real this time. Concentrate. Concentrate without the guideline of a star. One more. Healing touch. Here we go. Ah, just a little more. This is it. This is exactly like before. I have the healing touch. Well, maybe I overdid it. I give myself a headache. Operation successful. Wasn't really an operation. Hyperfixation mode, go! He's just standing there staring at the patient for 6 hours after the surgery's over, and they're like, Derek, are you okay? And he's like, I think I'm getting the hang of it. Good luck with your laundry, Nano. We did laundry yesterday. It was rough. I might be able to control the healing touch. Nothing went wrong. I just find doing laundry rough. Rick Riordan demigods. Okay, sip, beep. There's so much to do. It's like you have to get the clothes. You have to take them to the washer. You have to put them in. You have to remember to come back. And then you have to put them in the dryer. You have to remember to come back again. It's a lot. That concludes this meeting. Review the information on your own. Let's just begin our surgical conference now to save time. Those doctors involved, please stick around. That's me. We're starting, Doctor. Dr. Stiles, pay attention. Yeah? What? Sorry. I guess I didn't hear you. He's got superhuman concentration, everybody. Our lad has superhuman concentration. Is everything all right? You've been staring at that x-ray for a while now. I was just going over today's operation in my mind. Oh, Cronus, that's the secret. You don't have to do that. You leave it in the basket. And then when the basket is empty, you do the laundry again. There you go. That's the secret. Girl's trick. I was just going over today's operation in my mind. Anyway, let's get the conference started, huh? AKA the power of Satanism to heal people. You're so right. Hello, Black Knight. You just keep the bag of sorts exactly. You put it away? I don't. Never have, never will. Oh, you wash the bag too? He's been spacing out a lot recently. At least he's concentrating hard on something, I guess. Today's patient is Mr. Kovac, who carried in this morning. He's currently... You know, sometimes I wonder if speaking is even for me, if I should do it at all. He's currently not doing very well. Tests show a number of aneurysms near his large intestine. Some of them have ruptured, and there's risk of anemia. With your clothes on so you get two things. Satan's Son would be an upside down star. We gotta turn the DS upside down. I don't know if there's a button that does that. I know there's a close the DS button. Harpy without her voice, like an angel without her wings. We need to perform a laparotomy and treat the aneurysms. The objective of the operation is treat the aneurysms on the outer membrane of the large intestine. That should be all. First, inject a sedative into the swollen vessel to reduce its size. Excise the problem area and suture the vessel closed. You'll need to use magnification again to help your accuracy. Derek, concentrate on the patient. Don't worry about anything else. Okay. Let's begin the operation.
Let's begin.
The antihypertensive is in effect, but the aneurysm could still burst. We need to hurry, Dr. Stiles. Take our time. Let's get his vitals up a little bit.
Doctor.
The lump on that vessel is the aneurysm. Try magnifying that area. Let's avoid worst case. First, put the sedative in the aneurysm. Put the sedative in the aneurysm and shrink it all down. There's a lot of blood in the way. Drain the blood first. Anastomosis. Anastomosis. The aneurysm's been treated. We can finally relax. You might have wanted to become a surgeon. Instead, you played Phoenix Wright. I played both. And I became a streamer. What? Again? Every vessel in the area is in danger of becoming an aneurysm. Continue the operation. We'll just have to treat them all. You go boop. Drain. Drain. Connect them. Oh my god. Getting a little ridiculous, sir. Oh god, it's at the top of my screen. That's gonna be- oh my god, more. Alright, everybody calm down. Is this all of them? Are there more? No, it's just these two. Okay. We can- oh, nope. We need this. Oh, these vitals are getting kind of low. Okay. Oh, gotta remove that guy. Okay. Good work. I think it's settled down for the time being. We should wait a moment to be safe before we close him up. Holy hell. Okay. So we're gonna do that. Oh god, we have a very limited amount of time here. Oh god, we need to magnify? It has to be magnified. Okay, I didn't know that. That was my bad. Oh, I'm wasting it. I am wasting it. I am shrimply wasting it. Okay. Oh, why can't I touch here? Come on. Oh god. Please, get smaller. Oh, we have so little time. Okay. Okay. Usually if you do that, if you get it to this point, they give you a little break. That's the secret. That's the tech. So that they don't start anything while you're in like a period like that. That's why you gotta disconnect all the aneurysms. And then you can just kind of leave them there. Whew, alright, that gave me a spook. It did me a small frighten. His vitals got pretty low there for a second. But we're doing okay. That. Oh, it's right at the top. There we go. Right at the last second. Was that the healing touch? No. No, it was really early on. It was really early on. I fucking beefed it. Oh, the crippling debt from Animal Crossing, yeah. If every doctor had that ability, what would the world be like? I'm sorry, let's close him up. Now just suture the incision. Girl, I barely used the healing touch for that. I raw dogged most of that operation. Another operation complete. Great work, Dr. Stiles. The green healing juice? I know, health insurance would never... They'd be like, if there's green healing juice, we're gonna suppress the shit out of that. That's not allowed. Just this magic stabilizer that heals patients. That's fair. That's fair. I beefed it. I did beef it. So, I understand you figured out how to control the healing touch. Make sure you don't rely on it too much. You still need to hone your basic skills. Huh? What the... I know it won't be easy, but you didn't take this job because everything's going black. Derek? Are you even listening, you stupid bitch? Derek? What's wrong? Save the game. You died. Priced it at 50k a gram. Maybe that's what Nickelodeon slime was. You're right. I don't remember. You might get a special bonus if you don't use the healing touch. But if you also get a time bonus though, and I think it slows down the timer. So like, I don't know if it's better to get the time bonus. I guess it depends on how judiciously you use it. I take a sip. I take a bite. Nickelodeon slime was food dyed lube. It seems so thick, though. Oh, none of my business, I guess. Forget about that power. But Are you prepared for the pain that would bring you? I became a doctor so that I could help people. And if it cost you your life, you'd give up your own happiness. I don't know, but I do know that people need my help, and I want to help them. Where am I? It's the ceiling? What am I doing here? Dr. Stiles! Angie? What happened? After Mr. Kovac's surgery, you just collapsed. You've been asleep for 3 days. What? 3 days? What about my patients? I have operations scheduled. Already taken care of, Derek. I called in the other doctors. They don't have the healing touch. That's in the past. We have to discuss how to proceed from here. Okay. Derek, I forbid you from using the healing touch. Oh, I'm gonna get a lot of bonuses then. I should bring him to the hospital. But why would you? That ability puts a tremendous physical strain on your body. It's too risky. What if you collapse while performing surgery? This is what they said to me when I asked if I could work as a lifeguard while I actively had a 9mm kidney stone in my body. I said, can I work? And they said, what if you collapse from pain while you're trying to save someone? And I said, that's fair. But without my healing touch, Mr. Kovac could have died. Exactly. That is why you mustn't abandon the healing touch. I'd advise you to use it only when absolutely necessary. So I guess maybe they would have forced me to use it in that, even if I tried not to. After all, you shouldn't be relying solely on the healing touch anyway. Developing your natural skills as a surgeon is far more important. We can't assume the healing touch was the only reason Kovac survived. If you want to help people, then strengthen your natural abilities. I understand. Do they just yell at you? Do they just like, are they like, I should use the healing touch, but then they don't make you do but I know you can do it in the replay, but for story reasons, why would he have blacked out if they don't make you use the healing touch in the story, like in the campaign mission? Or is it just like, you used it? We're pretending. Take it slowly. I'm sure the power inside you will find its way out. Weird. Become the best surgeon you can, and one day you'll inherit the full heritage of Asclepius. Inherit the heritage. Yes, sir. I mean, I guess I have played games where they're like, you cannot use it and you'd still pass out. Yeah, I have played games where they're like, they assume you did something on the stage and they talk about it. And I'm like, I didn't do that though. Doctor, an emergency patient was just carried in. Vitals at 60, CS is 300. I don't know what CS is. She's in shock and losing blood fast. Call the rest of the staff. We need to operate immediately. Angie, get that patient in the OR. Derek, you'll handle the surgery. I'm on it. The patient's a 17-year-old female. Oh, shit's about to kick off. Shit's about to kick off. Her case history is unknown. We found massive bleeding in her thoracic cavity. Derek, you need to perform a lobectomy immediately. This operation has one objective. Treat all injuries within the thoracic cavity. We'll go from there. Drain the blood first, if it's a large laceration. After that, use the forceps to close the area, then suture it. Oh, new mechanic. Just be sure to drain any blood before moving on with the operation. Hurry, Derek. Let's begin the operation. Blood pressure and vitals are dropping fast. What can we get her to? 65. Jesus Christ, that's a D. Oof. What? How could something like this happen? If there aren't any external wounds, this isn't possible. The cause doesn't matter now. We need to stop the bleeding first. Understood. Doctor, let's begin treating her. The large lacerations need attention right away. Drain the blood. These are awful. It's too dangerous to try to suture them. Try using forceps to close the wound before suturing it. Yeah. Make it vaginal. The bleeding stopped. Now try the other areas. Oh, her vitals just got really low. I didn't realize that as I was doing this. Okay. We're done treating those, I think. Move on to the smaller wounds. Don't relax just yet. Don't relax at all. Oh yeah, that's one of the mechanics they change in the Wii version. It's the large lacerations thing. That was bad? You're bad. Everything's been sutured. She's going to make it. I hate to think what would happen if she'd arrived later. No, bitch, I know it's still in there. I wish I could use my knowledge from the future.
Nice work, Dr.
The operation was a success. Good work, Dr. Stiles. You did well, Derek. Thank you. Now we get to know Linda. She's a sweetie. A senior surgeon. Where and what did those injuries come from? I don't know. It'll probably take some time to figure out. She'll be hospitalized for a few days, so let's keep an eye on her. Did you notice the cuts across the self-harm warning? Yeah, they looked recent. It seems like her real illness is deeper than we expected. If that's the case, I don't think we're finished seeing complications. Hope Hospital, room 201. Get away! I never asked you to save me. Leave me alone. Please calm down, Miss Reed. It's all right. I could feel my chest on fire when I passed out. I was finally going to be free. Why did you bring me back? I didn't want to live. Why would you want to die? You're still young and have your whole life ahead of me. Yeah, there's something to look forward to, huh? How come everyone says that? My life sucks. I'm tired of all this pain. I'm not pretty enough to date popular guys. I'm too fat, girl. My mom called me a failure yesterday because I might not graduate. Is that a life you'd want? I'm never going to be happy. That all depends on my attitude. What a joke. A positive outlook won't just solve my problems. Then maybe you should die, Angie. Angie's a Rachel for sure. If we're doing Animorphs casting, Angie is big Rachel vibes. There are patients here who have to fight just to breathe properly. Every day someone dies after a long and futile struggle to live. I'm sorry we saved you. Wow, Angie, I won't say that. That's rough. Angie, I know you did your best, doctor, but I'm afraid it was a wasted effort. Stop talking like that, Angie. Jesus Christ. I have other things to attend to. I'm sorry you had to waste your time operating on me. Helping someone is never a waste. Just leave me alone. I don't blame that nurse for hating me. I would too. I'm not going anywhere. You're still sick. What kind of surgeon are you then? I thought you fixed me. It's not that kind of sickness. A doctor's job is about more than just physical illnesses. Yo, early 2000s Menhera? Nurse Angie taught me that. It doesn't seem like she would have taught me that given her speech just now, but she did. When I was little, I had a cat named Tama. We were playing one day, and he ran out into the street. Oh my god, I'm gonna cry. I wasn't fast enough. A car hit him, and I blamed myself. Thank you for the follow, Rick Seeger! It was my fault Tama died. Great time to join. I had a cat named Balls. If only you had a cat named Taka. That can mean hawk. I really thought I killed my cat. It was all I could think about. I told my mother I did a terrible thing, and I wanted to die. What happened then? She slapped me. Hard. Is this a bird while looking at a butterfly? Yeah, I made a meme of that with me. Hello, 26 unit. Mom told me Tama would be ashamed of me, and that she was too. I don't know that the cat would have been ashamed of you, to be honest. But she also said that I'm the one who should be most ashamed of what I said. She said that to you? Who'd you grow up with, Linda? Huh? Do you have any siblings, or what about pets? Just my parents. And my friends at school, I guess. Could you look at those people in the eyes and tell them you wanted to die? No way. Of course not. That's why I want to be left alone. Then hold this. Hold my beer. Linda does not come off as the type to have friends, but I would imagine she has, like, somebody who's a friend. A mirror? Look at that girl there and tell her I want to die. I want... Yeah, no, Mike, I agree with you. But I also think that there are some cases that it's a mixed bag. It all depends. I couldn't do it either when my cat died. Now, apologize to her. I'm sorry. And this is kind of like, I feel like this is sort of a very truncated version of what they do in therapy, where they teach you to like care about yourself as a person as if you weren't you, and then you're like, okay, now say the same thing. And it doesn't work for everyone, but I'm sorry. I'm so sorry. Stop living to please other people and start making that girl happy. Don't work hard in school because of your mom. Do it because you'll learn more and be a better person. Don't let other people decide if you're happy or not. I don't feel like that's what's happening, and I do feel like you're being pretty dismissive, but I'm glad you're trying to help. Find things you enjoy and do them. It's that triple! It might not make you popular, but you'll like yourself a lot more. And you aren't too fat. I've seen your charts, remember? Your mother sounds wise. Really? She could be pretty weird sometimes. But then she'd say, I may be weird, but I think of all the stories you'll have to tell. That's interesting. Sorry. I guess that was too much information, huh? Really, though, she's great. I should let you rest, though. I think I'm gonna take a nap. That's a good idea. Sorry for talking too much. Next time I'll... Thank you. Huh? You're a good doctor. Too fat. Thanks, Derek. Yeah, as you're not too fat. Don't let other people judge your body, is what he should have said. Not, you're not too fat. I've seen your charts. Whew, time for a break. I'll go get us some coffee. Do you want to talk about what just happened in there, Angie? Thanks. That's a great idea. I passed by Linda Reed's room on the way here, but... Is something wrong? Her parents were there. All three of them started crying and apologizing all at once. It seems like a lot more was going on than we thought. Than you thought, you mean? Because you were a judgmental bitch. School, her father's job. Were you eavesdropping? Well, I was curious. I didn't hear anything that was worth dying over, though. Okay, so you're still a bitch. Everyone worries about that stuff during high school, you know? I think we all handle our problems in different ways. But I'm glad her family came to visit her. Surgeons aren't really equipped to heal psychological wounds. Don't sell yourself short. I can only try. I don't know what that was supposed to be. Anyway, if her family knows about it, then they can help her. Yeah, I think she'll be fine. Fucking bright-eyed optimism, Angie. I know some shit about your life and your family that you would not like it if I knew. That girl's lucky she was brought to this hospital, though. Huh? Why? Well, it's only a rumor, but I hear there's a death doctor. What the fuck does that mean? This sounds like some Persona 2 rumor bullshit. A what doctor? Jesus, I forgot about this. If they'd been treating her when she asked for that death doctor, huh? I really can't understand why anyone would want to die. That's good for you. I'm happy for you. I'm glad you don't understand that. Exactly. You have to find things that make you feel good, even if they don't seem like the right, quote unquote, right things, right? People say that all the time, that it's like you have to live for yourself. And well, I think that's like the best motivation. Like, if you live because you're the person who feeds your cats today, that's like good enough for today. It's a day by day, and you have to take care of yourself for whatever reason you can like muster. You know what I mean? And yes, Kaoru and Kamina would absolutely think you are worthy. And I think you're worthy, even though that doesn't mean a whole lot. Derek, we just received strange results back on Linda Reed. Huh? Do they explain the bleeding in her lungs? Birb waifu, hi? Dnak K3? No, we did not. It was illegal. That's why she's like, I hear there's a rumor of a guy who will like do that if you want, but it was and is illegal to do that. Do they explain the bleeding in her lungs? I don't think it's directly related, but they found extremely high levels of Spyros in her blood? Even though this game was technically set in Japan. That's true. They did change the setting in the localization. Thank you for the follow, Kompipop. So like, I don't know that it was legal there, but so cyprohedrine in her blood. What's that? You're a doctor. You're a doctor. It's a new antihistamine, doctor. Oh, that's great. We love antihistamines. I know, we're so close. I don't want to freak out about it too much. They're usually used to treat allergies. That's what an antihistamine is. Thank you, Angie. I know that. So why didn't she tell us she was on medication? Because she wasn't. Drugs involving cyprohedrine are still in clinical trial. Oh, so it's fake. That's why I can't say it. It's like pseudoephedrine. Yeah, she's doing meth. Terminal illness, mentally competent. Oh. I didn't know that there were... I know there's like a... I know people have been pushing like right to die acts. I guess you can choose to seek palliative care. I know that, but like... I didn't know. Our tests indicate 24 times the suggested dose, so side effects from overdose include headaches and emotional distress. In extreme cases, the effects are serious enough to prompt... Jesus Christ! That explains her death wish. No, I think maybe she was being bullied. It may have contributed, but I doubt that. Thank you, Dr. Cassell, for being reasonable. Still, I've never heard of cyprohedrine being synthesized within the body. Whatever's causing that might be responsible for the lacerations. Oh, so something's like making this drug in her body? Doctor! What is it? Reed's condition is getting worse. She's complaining about excruciating pain in her chest. Oh, thank you. Yes, I think this is a very cute heartbeat, and I don't feel bad seeing that because I didn't do my art because I can't draw. Pride did my art, and Pride did a really good job. And her info's in my credits panel, and you should check her out. What? Antihistamine gives me restless leg stitches. My antihistamine. It hurts. Linda! Doctor, I want to live. Help me, please. I want to live. I want to live, doctor. Please. Derek, we're operating now. Angie, alert the staff. Hurry. Yeah, there aren't a lot of... I mean, I guess I don't know all VTubers, and there are definitely some Bird Girl VTubers, but I feel like we need more classic Monster Girl VTubers. We need more. Her blood pressure is decreasing at a frightening rate. We suspect hemorrhaging in her lungs again. There has to be some explanation why those lacerations are occurring, and its name is Sunday in Greek. Until we figure out what that is, there's not a lot we can do. You should have two objectives during this operation. Treat any bleeding injuries within the thoracic cavity. Discover what's causing the lacerations. Classic Universal Monster Girls? When? Absolutely. I'll be working as your assistant. Stay calm, Derek. Come g- What g? The only guys you know who like Monster Girls are absolute degenerates. It's okay to be a degenerate. It's also okay to not be a degenerate. It's both is good. We need a balance of lewd and not lewd things in this world. Dr. Cassell's gonna be my assistant. No, she wants to live. I have to save her. Once you balance both, you ascend. I have too much lewd in my heart. Why now? She said she wanted to live. I don't know, and these symptoms don't add up. Derek, take extreme care during this operation. Angie, keep your eyes on the monitors. Good luck, everyone. Just max out her vitals. Do a quick vital max. What? How? We fixed these 3 days ago! Derek, Miss Reed is still weak from the first lobectomy. Use the same treatment, but be careful. Oh god. That wasn't very careful or hot girl of me. I'm just gonna close up the small ones first. This is strange. We still don't have any idea what is happening. Pump those vitals. Alright, vitals pumped. Pump up the vitals. Pump it up. We've treated the lacerations. What's our next step? We need to close her up and have a closer examination later. Nice job. Suture the incision and finish. What is that? What the hell's going on? Doctor, try using the ultrasound. There's that little bitch. The hell, I've never seen anything like this. We have to get it out of the patient. What if we tried incinerating it with the laser? Good idea. Ha! Dumb bitch. Another one! We're gonna suture some of these, because it's just getting a little messy in here. Oh god, it's too messy. Okay. We survived Sunday. Hey, it's Sunday! Happy Sunday, Minya! Oh god! I forgot about that. How many are there in here right now? Oh, it's the big boy. He's gonna resubmerge. And then we're gonna get him out. We gotta find him. Where is he? Where's fucking... Okay. Well, I'll just treat her vital. There we go. We found him again. What the... Where is he? There he is. One more ought to do it. Give me my knife. Okay. Whew. The Lord's Day. Yes, so fun fact about the parasites in this game, they're named after the Greek days of the week. I don't have an explanation for this. It's just what they did. And this one is named after Sunday. Kiriaki. Don't tell me that weird parasite was. Could it have been guilt? Why do you all know this thing that I don't know about? Just finish your operation, boy. It's a need-to-know basis. And then the explanation is foreign language, cool, many such cases. Hi, Mark. Asclepius, yeah, so that's Greek too. You are correct. But I don't know why they chose to name... It's like the names of the parasites are determined by the terrorist organization that's using them. So, like, I don't know why they named them after the Greek days of the week. Which, incidentally, with the exception of Sunday, the Lord's Day, and Saturday, the Sabbath, are just, ordinal numbers. Like, it's just like first, second day, third day, fourth day, fifth day. I actually didn't know them as a kid. And I should have probably, but my mom heard me saying them and she was like, why are you just saying the days of the week with an American accent? And I was like, what do you mean? I'd like to remind everyone that the details of this operation should be considered strictly confidential. Bring Linda Reed's medical files to my office immediately. I will provide updates as needed. That's all for today. Doctor, could this be guilt? How do you know about that? I don't know much. I saw it mentioned in my father's research. Yeah, you did. How did your father come across something like guilt? Well, he was a researcher. Other than that, I don't really know. In the second game for the Wii, there's a new terrorist organization and their parasites are all named after Latin parts of the body, and they call themselves Soma, which is Latin for body. And I thought that was very funny. And I did get it that time. Give me some time to figure out the situation. Until then, don't mention guilt to anyone. Understand? Yes, sir. What the hell is guilt? Caduceus. Gangliated utrophin immunolatency toxin. They'll probably tell me that at some point. Greek gods are dead. It's time to name the days of the week after VTubers. Happy Birb Day. Taka Tuesday. I'm here. Please enter. Pardon me, but why was I called to your office? Why don't you have a look at this examination report first? Kind of sociopath arrow. What the fuck is guilt? Who's this for? Linda Reed. What do these headings mean? I don't recognize them. Positive chiral reaction? Guilt. Positive. Spectral analysis G1R? Those tests are beyond our capabilities, so we enlisted help from an outside organization. In the last few years, a bizarre disease with varying symptoms has been reported in several isolated cases. The one thing they had in common? Each victim's body turned against itself, and they all died. Because of that, we believe each subject was infected by guilt. Gangliated utrophin immunolatency toxin. He doesn't even say it out loud, that's just his thought. Then, you think Reed's illness was... We had a massive pantheon of VTubers, you're so right. They're gonna think that, like, VShojo and Hololive were at, like, warring factions or something. I mean, they kinda are, but, like... I'm surprised you were able to treat her without the proper resources. Gaurgura, goddess of baseball. It was a difficult operation, but I wanted to save her. Well, that decision may have changed your life. The organization we mentioned before has shown interest in you. What? Why me? Your unique abilities were able to successfully cure a guilt victim. What organization is it anyway? I know you mentioned it, but I wasn't listening. Oh, they get a lot. I mean, like, how do I put this? I guess I mean, like, they always assume that people who worship different gods fought. So, like, they're gonna think that the different fans were, like, warring factions. Niji Sanji and Face Connect. Ooh, I don't know. I know, I'm, like, not up on the VTuber drama. I know, like, the VTubers I know, and then I don't know anything else. They're an arm of the World Health Organization that specializes in exterminating intractable diseases that threaten mankind. They're called Caduceus. Caduceus? I remember seeing them listed in cancer and AIDS treatment essays. Aren't they the ones who eradicated the TFTA influenza last year? Caduceus wants me? What are you going to do, Derek? You've been offered a chance to work at the forefront of modern medicine. Caduki? Well, I mean, it's an honor, but it's also sudden. I'm not really sure what to do. I mean, it'd change my whole life. You don't need to decide right away. Just remember that this is a choice, not an order. The only reason I told you this is because an old friend asked me to. To be honest, I'm against you joining Caduceus. What? Why? I don't think a research laboratory is the right environment for you. Didn't you say you wanted to help patients face to face? That's true. You should see this as well. It's a letter? Kiriaki, Sunday. Oh, I guess I just didn't notice that they translate them. Death is denied those who want it, though it be their destiny. They search for it like a treasure, but the modern age conceals it. What's this supposed to mean? It arrived shortly after Linda Reed was hospitalized. We don't know who sent it. Supposedly, these letters arrived shortly before guilt does. Huh? That means guilt doesn't occur naturally, which means it could be some kind of man-made virus. I pronounced it Caduceus before, and then I don't know. I'd have to see it written in Greek to be sure. It's the name of the staff, though, right? It's Asclepius' staff. I'm gonna Google it. I know in Japanese they said, like, Kaduk, but that's Japanese. Because it's like the medical staff. Oh, it's Hermes staff, actually. Is there a pronunciation? Oh! It is, S. Caduceus. It's a hard kappa in, Greek, though. Caduceon. So, we'll go with Caduceus. Oh, somebody got it for me! Caduceon. Hi, always armored! Still funny that the US medics use the wrong staff because it looks cool. It does look cooler, though. What? Someone is creating guilt and releasing it into society. We don't know who or why, almost as if it's meant to confuse us. The UN even created a new term to describe this. Medical terrorism, as though bioterrorism hadn't been invented in 2006. Caduceus is anticipating a large-scale guilt outbreak, although I guess that was... bioterrorism included releasing diseases, I think. Biological warfare included, like, Attila the Hun throwing plague victims into sieged cities, so I think it should count. And they need skilled doctors to be ready for it. Hopefully in how you see the stakes involved in this. Think it over. Don't make your decision lightly. I don't have a choice. What year was this? It came out in 2005 in Japan? And I can't remember if it came out in 2005 or 2006 here. Rule of cool prevails. Textbook bioterrorism. Yeah, see, that's what I thought. I was just having this conversation about exobiology versus xenobiology and animorphs because they use the word exobiology, and I was like, wouldn't it be xenobiology? But I don't know. Room 207. Thank you so much, doctor. Just hurt so badly. Thought it was a goner. Well, appendicitis is a fairly common procedure. It's not the name of the procedure. That's an appendectomy is the name of the procedure. Appendicitis is the name of the condition. But congratulations on your recovery, Mr. Sassano. We didn't change your name. If my wife gets sick, I'll make sure you're the one operating on her. Well, it'd probably be best if she didn't get sick at all. Please don't, like, feed her rocks or something. I guess that's true, haha. Talking with the patients is one of my favorite parts of the job. Could I really leave that behind? Derek, we'll be starting the operation briefing soon. Okay. Oh, I love this mission! Today, you'll be operating on Alyssa Chalk from Pediatrics. She's a very young child with valvular heart disease. It was a tough decision, but her parents finally decided to go ahead and have the procedure done. There's only one main objective for this surgery: replace a valve in her heart with a synthetic one. We'll use a triple incision to excise the valve. Cut 3 times. That's what 3 times through the grinder. Smoothly. You'll need to be as cautious as possible, understand? Technology has allowed us to deal with all kinds of situations, but heart surgery will always rely on the doctor's skill. Angie, keep an eye on the oscillograph to aid Dr. Stiles. That's a thing that goes back and forth. I understand. Don't let the gravity of this operation intimidate you. The conference is over. She's in your hands now, Derek. She's so small. She's 138.7 centimeters, 84.4 pounds. She's so little. Let's begin the operation. Her report details frequent occurrences of light arrhythmia. Be ready for the unexpected, just in case. Let's get started with the operation. Disinfection complete. Blah, blah. Fucking killing it. Oh god, we gotta go deeper. What? The electrocardiogram is showing an abnormality. She's suffering ventricle fibrillation. I'll attempt to stop the convulsions. 3, 2, 1, clear. She's flatlining. You need to massage her heart. Doctor, the patient was born with a highly irregular heartbeat. There's a good chance her heart will continue to go into convulsions. That's kind of why we're doing this. I'll stand by with the defibrillator in case we need to use it again. If that happens, you'll need to massage her heart immediately. The defibrillator may have a high success rate, but allowing the heart to flatline repeatedly is obviously very dangerous for the patient. Make sure you revive her right away if that happens. Now, continue the operation. Please open the atrium. Oh, like the cool area, the Gaylord with all the glass? This will be touchy. Magnify the atrium. Let's begin the valve procedure. We will excise in 3 stages, but before that, we'll need to drain all this blood. Visibility is clear. Okay. Excise the right side. Oh. Too much blood. Okay, we gotta sit still because she's going into arrhythmia. And if you touch her while she's going into arrhythmia... Yeah, clear! I think they changed that to a defibrillator in the Wii game. Probably because the motion tracking wasn't quite good enough for that. Don't do it again. Girl, calm down. Girl. Please don't. Girl! Girl!
Vitals are critical.
Could you please give me 10 seconds to work on your heart? The answer is no. I can't put this down. I have nowhere to put it down.
Critical.
You call this a light arrhythmia? This is ridiculous. This girl needs a defibrillator put in her chest. Don't you do it again. Girl, come on. Girl, girl, thank you. Too much blood. Girl, please. Whew, okay. What a relief. The operation was a success. Now she can play outside with all her friends. Oh, so you feel sympathy for her, but not the teenager who was going through it. I get it, Angie. I get it. It's cool. Poor girl. She's too young to go through something like this. Having someone cut open your chest is so unnatural. But something in that little heart refused to give up. Maybe it sounds silly, but I keep thinking about it. The human body is truly amazing. That's why you became a nurse with a head that's too big for your body. Yeah, that didn't go great, if we're honest. Oh, hey, that went all right. Hi, Mom. That's my mom. Tomar Games. Her head is large to store all the cognitive dissonance. It's my daughter. Will Elisa be all right? The operation was a success. She'll need about 2 months to fully recover before she can go back to school, but after that, she'll be good as new. That's good news. Oh, thank you so much, Doctor. People are always worried by heart surgery, especially on children. But modern medicine allows us to treat various conditions with a higher success rate than 10, even just 5 years ago, in the future of 2018. Young patients like your daughter face very little risk of permanent physical damage. To be honest, I'm more worried about the psychological stress operations like this might have on small children, but you'll have to deal with that later. Please take good care of her while she goes through recovery. Oh, of course. Elisa, we love you so much. Modern medicine. Doctor, I'm very sorry. Modern medicine just hasn't advanced enough to treat a disease like this. You have our condolences. Mom, why are you crying? That's okay, right? Oh no, Derek's dramatic backstory has been unlocked. He's gonna get better, right? But why isn't Dad getting better? You can fix him. You just gotta. He's my dad. I'm sorry, son. No doctor in the world could save your father from this. Things have come a long way. Dr. Hoffman, I'm going to accept the offer from Caduceus. So, you're willing to throw away all happiness for this? For this? I know about what happened to you in the past. I know that having superior skill will only result in more pressure. That everyone will expect me to have answers nobody else has. I'm sure your concerns are valid. The path I've chosen will probably cause me a lot of pain. But I became a doctor so that nobody would have to die from an incurable disease ever again. Diseases are painful, and losing someone to a disease is even more painful. It's hard for doctors to tell people their loved ones can't be cured. I'm going to make sure they won't have to. Caduceus has already found ways to save thousands of sick people. If I can somehow help incurable diseases, then I will join Caduceus! Felt like he said that real dramatic. Chapter 3, Caduceus. Ah, we're barreling through. Gotta take a sippy. Actually, I think we will take a little break. Get up, stretch legs. And I will see you all in a couple of minutes. I go to sleep. We're back. Oh, I have to wake up. I wake up. Safe for work pole dance to the BRB screen music. It's it's Char 640. You can go. I have I think it's their Bandcamp for this in the credits. They did the music. So they did, that's my starting screen and my BRB screen music. And I just, my sibling did the music with a friend. So like, I was looking for music to use and I was like, hey, can I use this? And they were like, yeah, totally. And I was like, yay! Yeah, I think they only have a couple things out. I know they have projects they've worked on that they haven't put out, so if people go poke them, maybe they'll do more. Alright, first day with Caduceus. Are you worried? I wouldn't say worried. We're down one doctor and one assistant. How are we supposed to operate with two of our best people gone? Derek has potential, but he's far from perfect. I wasn't going to send him off to Caduceus without an assistant he's comfortable with. Besides, Caduceus is supposed to assist us in finding new staff. I see. Still, I don't expect Styles to be the selfless type. You didn't? This man was like, I got into medicine to help people. And you're like, I didn't expect him to be so selfless. Do you think he'll be able to handle the pressure? I suppose we'll find out. He's going to be surprised. I didn't get a chance to tell him about Sydney. Caduceus, an international organization which seeks to eradicate disease. Caduceus USA is the name of the American branch. Strong branding. There are additional branches in Europe and Japan. The US branch researches special anti-infection measures as well. It was originally established in 1980 as a top-secret offshoot of the Department of Health and Human Services. Wow! Once the organization went international, the central agency was renamed Caduceus USA. They are authorized to act on their own outside of the government's approval. They would not get away with this today. Seeing a doctor genuinely... It's like, what kind of guy wants to fucking help people? That's weird. Derek Styles, you can come in now. Hello. Huh? Welcome to Caduceus USA, Derek. It's nice to meet you. I'm Sydney Casal, the director here. My brothers told me a lot about you. I'm glad you decided to come. Decided to what? Sydney Casal, age 35, chief director of Caduceus. He dedicated his life to the study of clinical medicine after his wife died of illness. Oh, yeah, I think Dr. Casal mentioned having a brother. I mean, it was an honor to even be considered for this job. Angie Thompson, you can come in as well. Yes, sir. Well, it's a pleasure to meet you, too. You're young, but I hear you're hardworking and sharp as a tack. I look forward to seeing what you both can do here at Caduceus. Thank you, sir. I'll do my best. The Secretary of Health and Human Services should be here shortly. When I told him you were both coming today, he insisted on stopping by. He's in charge around here, so I'm sure you'll be seeing a lot of him. Right this way, Mr. Secretary. Congratulations, Derek, Angie. I'm Richard Anderson. Well, perhaps it would be more appropriate to say thank you. Richard Anderson, current Secretary of Health and Human Services. After a long career in politics, he became the director of Caduceus. If he's the director of Health and Human Services, he'd... okay. Thank you for accepting such a dangerous job. I'm told that operating on guilt puts the surgeon at risk, too. And we still have no idea who's responsible for spreading it. Dot 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 from Angie. Yeah, gee, I wonder. My dad had research notes on it. But from what I hear about you two, you're up to the task. Scientific advances, DNA treatments, changing social environments. We live in challenging times, and it's our responsibility to research and create treatments which ensure the stability of our world health. I do like that they were like, this is actually America. And then on this map, there's like nowhere in America that this layout of land would exist except like maybe Florida. What all this means is, I'm pleased to have you both on board, unless it's in the bayou. Yes, the classic Atlas Japanese America. I hope you'll do your best. Take your work seriously. Yes, sir. Caduceus USA conference room. Are we gonna meet the hottie? No. Yet, no. And this is Dr. Clarks, our expert surgeon. Oh, I wouldn't say expert. There's still room for improvement. Stephen Clarks, age 42, Caduceus' head surgeon, has a wife and 2 kids. His kind demeanor has comforted many sick patients. Nice to meet you. I'm Stephen Clarks. Nice to meet you, Dr. Clarks. This is our anesthesiologist, Dr. Myers. Hell yeah, this is the hottie. Name's Sybil. Nice to meet you. Sybil Myers, well-respected anesthesiology specialist. She used to be a police officer, but left the force to practice medicine. What a background. Oh, wait, Mike, there might be a guy in here for you. She's intelligent and very spirited. Some call her the Iron Vixen. You're from Hope Hospital, right? Isn't that Greg Casal's office? Do you know him? We went to med school together. He helped me in a lot of ways. I'm actually the only one here who knew Sydney was his younger brother. Anyway, if you have any questions, feel free to ask. Of course, it's nice to meet you. Some of our staff aren't here today, so you'll have to meet them later. Think this'll lighten our workloads? Doubt it. Have you taken a look at the list of incoming patients? Oh well. Do you guys get to work with a lot of patients here? The public doesn't know yet, but we're on the verge of an outbreak. Congress recently voted in favor of a budget increase, but that won't be good enough. We're going to have you start treating patients tomorrow, so for today, let's get all that paperwork out of the way. Sounds good. Sheesh, who knew paperwork could be so tiring? It's pretty late. Yeah. Hey, why'd you come to Caduceus anyway? Does it matter? Well, I was just curious why you decided to join too. Dr. Casal recommended me. That's not what I meant. Before, it seemed like you knew something about guilt, so does it have anything to do with your father's disappearance? Not really. Caduceus has the newest technology and research material. I wanted to be here, on the front lines of modern medicine. It's the same as your wish to become a master surgeon. I want to be a master assistant. That's really all there is to it. I guess that makes sense. We'll work hard together. Potassium chloride's ready, so if we increase the sedative... Huh? Sounds like someone's on the phone. Derek? I gotta run. Yeah, I'll get back to you, dude. No way. Tyler? No way, no way! You seriously work here now? Tyler Chase, a Caduceus surgeon. He went to med school with Derek. Tyler's very optimistic and tries to keep everyone in a good mood. Yes? And it's very nice to meet your gorgeous assistant. My name's Angie Thompson. Nice to meet you. Man, I heard him say the new doctor was Styles, but this rocks. I didn't think you were adventurous enough to join Caduceus. And I mean, you weren't exactly an A student, man. But they've been hyping you here as a highly skilled surgeon. What? Nobody told me anything about that. I don't want people expecting too much of me right away. Well, you have a pretty good track record so far, Dr. Styles. People can change a lot in 3 years, you know? What about you? You were probably one of the top 5 in our class. I guess you can see for yourself, huh? Good luck, man. We ought to throw a party or something. See ya. I can't believe Tyler works here. Oh, sorry. Tyler's a friend of mine from... Oh! Arthur? Thank you for the raid. Oh my gosh, budget raid. Thank you for the follow, Milk Bull. Okaketsu, thank you so much. Hi, Arthur. Welcome in, Raiders. We're playing Trauma Center Under the Knife. Imakuni, thank you. Beefy McSteak, thank you. I'm reading them out of order. Oh my gosh, thank you. Welcome in, everybody. Thank you so much. I don't have that shout out command. You have to do the full. We have the that one. Thank you, Mike. Thank you. Welcome in, everybody. Oh, my follower goals reached. Oh my god. Yeah. Oh my god. This is so amazing. Thank you, everyone. I'm so glad you could all be here for me to hit 101 Dalmatian followers. You're all Dalmatians now. So, yes. We are young, intrepid surgeon Derek Stiles, and we have just transferred to the most, prestigious medical institution in, Japan America. Famous Atlas Japan America. Don't skin you and turn you into a coat. I wouldn't do that. I would never do that. As a fellow creature myself, I would not skin you and turn you into a, I can't make promises for Nano. I can't make promises for anybody. I take a bite. What were you up to? What were you doing? Okay. His skin would make fantastic. It would be a very pretty color. A red leather. Very pretty. You wouldn't have to dye it even. So thank you, everyone, for... Oh, I miss DJ Kawhi Fieri. Great name. Thank you for the follow. Thank you, everyone, for your follows. Thank you for coming in. Reese and I were reacting to a 2-hour video about a couple with horrific finances as a financial planner screamed in that sounds really stressful. Grimoire made of Arthur skin would go so hard. Well, you know what your next merch item is. You regenerate your skin, right? So you can just make more. Don't you have special demon abilities or something? Little imp abilities? Imp abilities. It's hard to say. It was a bonding moment. Yeah. Financial planning is if there's one thing, it could go on the shelf with our Necronomicon. We do have a Necronomicon. A friend asked me if I wanted any housewarming gifts, and I said, I think all we need is a Necronomicon. And I got an Etsy Necronomicon in the most beat up, terrifying looking envelope. There was one small Etsy slip included to let me know that it wasn't actually someone sending me a terrifying artifact. It's not how it works. A Timu Necronomicon. Yeah. What would those spells do? It would be do you remember the Fable quest where you find two guys who found the Necronomicon and they keep summoning zombies by accident? I feel like that feels like influencers who bought a Timu Necronomicon. I think we could do something with this. All right. So, yes, Tyler's an old friend from school. We just ran into our old friend from school. He was making a strange phone call that was probably not suspicious at all. And he's got kind of surfer boy energy. That's what he projects, but he was actually top 5 of his med school class. Yeah, Tyler, he's great dude. Great dude. We love Tyler. And then we've got sodium chloride. At least it wasn't sodium pentothal. And then we've got Angie here. We've got our son nurse, Angie. Yeah, I kind of figured that out. He was the professor's favorite, so I assumed he'd stayed in school. Potassium chloride, huh? I wonder if he's doing animal testing. I feel like there's lots of things you could use potassium chloride for. Oh yeah, sodium chloride's just salt. I guess that wouldn't be suspicious. We saved a game. But yes, thank you for the follow. Yes, thank you so much. Welcome in, Raiders. It's so good to see you. feel free to take a moment, stretch your leggies, get your drinkies, do what you gotta do. And yeah, I hope you stick around or don't. If you gotta go, that's fine. Black Knight, thank you for the follow. Wait until 1 of 3 were in Wonderful. Thank you for the follow. Oh my gosh, wow. I can't believe we hit the goal. I'm so like, I'm so excited. Okay. Several guilt victims are currently, oh wait, I did like a nasally voice for him. Several guilt victims are currently hospitalized at Caduceus. We obviously need to treat them ASAP, but we don't know how. So at the moment, we're trying to slow the disease's progression. I had a lot of trouble operating on guilt as well. Today's patient is similar to your previous experience with guilt. I watched the video footage of your surgery at Hope, but you moved so quickly I couldn't tell what was going on. Joke's on you, bitch. I didn't even use the healing touch. How soon to the sub button? The how soon to the sub button is, I believe, thanks to all of your amazing generosity, I should, after this stream, just have to stream 6 more times in a 30-day period to make affiliate. You guys have, like, really blown me away with your support, and it should be coming soon. So I'm really excited. Yeah. Yeah, I hit the average viewers. Chicken Coop Enjoyer, thank you for the follow. You feel like you belong here with the Burbs, the Burb Watchers, as they may come to be known. So yeah, you guys have Nanomod. Oh, is it a friend of yours, Nano? Nano is our mod, yes, is one of our mods. Nano was kind enough to volunteer their services. Nano is very, very skilled at everything they do, and is also extremely cool. I know this. I've met them in person, and their jong skills, off the charts. Off the charts. Yeah, if I can commission little sub badges, I kind of want them to be little binoculars that like change colors. I think that'd be really cute. That's my goal for your little sub badges. I have to figure out, and then I gotta get emotes. There's so much to do, so much to see. So what's wrong with taking some time off to focus on surgery? You know what I mean? I really like am genuinely blown away and can't believe how amazing and receptive everybody in the community has been. It's really, really, really awesome. Milkbowl. Did I forget the rest of the lyrics? I did not forget the rest of the lyrics. It's so what's wrong with taking the back streets. You'll never know if you don't... Fuck. Is it go? You'll never shine if you don't glow. Which, that one just sort of seems like a tautology, if I'm being honest. Hi, Milkbowl. Yeah, I know those lyrics decently well. It's just go, not fuck go. Ah, fuck go. There's a Wii remake of this game where they redid all the art. I do plan to, my plan right now is to play the 2DS games first and then hog tie a Wii to a component to HDMI converter and try to play those with the original motion controls, because Trauma Team, which is the last game they made, involved being an orthopedic surgeon and hammering like pins into bones, and that just doesn't feel the same if you don't get to make the hammering motion, I think. So yeah, maybe we'll do Trauma Sundays. Maybe that'll be the Trauma Sundays. But they also did a Wii port as a launch title where they redid all the art and a bunch of the mechanics, and then they did a Wii sequel, and then they did a Wii spin-off, but then there's also a direct sequel to this on the DS. Trauma Sundays sounds peak. It's just like church. It's really just church. Trauma Tsunde. All right. I'm looking forward to seeing you in action today. Let's see what you got. Don't put pressure on me. I'll just suck your feathers, Stuart, right off the bat. Oh, thank you. Thank you. I worked hard, and I said at the beginning of my last stream, I'm like a lifelong theater kid. So like, it's you know, in my blood a little bit to just be shoved in front of a bunch of people and make do when things go wrong. So, which one's the one where surgeon does surgery on a nuclear bomb? So it's not a nuclear bomb. It's a regular bomb. And that's in this game, and also in the Wii version of this game. We get sent to a conference, and the police officer turns out to the former police officer who's our now anesthesiologist turns out to have been in the bomb squad previously. So she talks you through disarming the bomb. It's quite fun. It's quite a good one. That's another one they totally redid for the Wii though. There was like in this one, because the drain didn't work very well in the Wii. And so like in this one, you have to constantly, the mechanism for detonation is these water tanks. And when the water fully fills over into like when it runs out of the one tank and is full in the other tank, the bomb will go off. So you keep having to stop and going over to that and moving the water back like with your little surgical drain into the initial reservoir so that the bomb doesn't go off. We'll get there. We'll get there. Dr. Myers will handle the anesthesia. Hell yes, she will. She definitely got a bit hotter in the Wii version, or at least I think they undid one of her buttons. I think they undid one more of her buttons and gave her some mommy milkers, if you know what I'm saying. I know you operate on her at one point, and like I remember as a kid being like, whoa, when I saw the like mannequin model that I was cutting open. I was like, those are some honkin' badonga-dongaroos, you know? Myers is a tough chick, Derek. If you screw this up, she won't ever work with you again. Stop trying to scare the newbie, Chase. Well, it's a difficult operation, and we don't have room for mistakes. Just do your best, kid. Wee booba upgrade. That's true. You got it. Motion controls call for bigger booba. I'll be offering your briefing on your next operation procedure. Today's patient is a guilt victim brought here 3 days ago. Derek, you've actually operated on this exact strain before. It was called Kiriaki, wasn't it? Sunday. Correct. This guilt hides inside organs and creates lacerations. Removing it, however, should be just like removing any parasite. We wanted a simple case to evaluate your skills. Sunday, yeah! There's only one objective in this procedure. Remove the Kiriaki. Remove the Lord's Day. There will be no days when we're done. The week will be empty. I'll leave the exact details of the operation to your discretion. Let's see your talent, Dr. Stiles. Yes, sir. Oh, we scrubbed up. We got a new scrub up screen. Okay, let's begin the operation. This is the same strain of guilt that Mrs. Reed, she was just a little girl, that Ms. Reed contracted. Let's begin. I'm like balancing this weird on my knee. The Kiriaki is causing these lacerations. Treat those first. Okay. Fuck me, I guess. Drip upgrade. That's right, we got new uniforms. It would be really funny if you could, like, change your outfits and get, like, different stats. It's like, you're better at suturing with this hat. Nope, fuck you, fuck you. On this, the Lord's Day. Kyrie eleison, Kyrie eleison, Kyrie eleison. Lord have mercy is right. Oh, Jesus. 3 of them. 3 of them. 3 big ones. It's just like Total Recall. Where's the 3rd one? Okay, I'll have to deal with these 2. That's the 3rd one. Okay, please give me a second before the big boy comes out to get her vitals back up. Okay, why didn't that count? Just gonna suture blindly in this mess. Cool. I'm so good. Oh yeah, and there should be some little nicks from where I cut them out. There we go. Stevie nicks, even. 3 big ones, that's right. We're not used to that here. That's one more than we're accustomed to. All right, big guy, calm down. I like how he, like, I don't know, his little silhouette gets a little scragglier each time. Great work. It's over, Derek. The chiral reaction is gone. Let's treat those last few wounds. It's several wounds, if we're being honest. I think they expect me to, like... So the thing about those is that they'll, like, keep causing these giant wounds if you don't just kill them immediately. So, like, what I've learned 20 years ago when I played this game, not quite 20 years ago, was that it was better to just, like, prioritize the removal of the Kiriaki and then deal with this stuff later. Alright, that looked like a pretty good job. I think they shouldn't. You were testing for chirality? We were, Angie. That's very observant of you. I said it, so, like, good job listening, I guess. Good A+ listening skills. Pleasure to have in class. Guilt creates cells with an unnatural chirality. Using the Chiron test, we can detect the specific wavelength they emit. Is that colors? I think it's colors. So far, that's the only way to reliably distinguish guilt. Remind me to give you the Chiron test equipment later. Sorry I wasted all that time, Derek. Finish up suturing the incision. God, I'm so cool. Derek Styles, master surgeon, an assistant, Mega Knight boss. Excellent work. I can see why my brother, not your brother, my brother recommended you. Okay, okay. That seems like a lot of points. That seems like a lot of points. Rank A, not bad. I do know that the top rank isn't Derek Styles the guy from Teen Wolf. I think that's true. I know there's a Derek and a Styles. I think you're right, actually. Wait, are they the same person or is there a Derek and a Styles? Derek Styles is the guy from One Direction. Unbelievable. He's still got a lot to learn, but that was incredible. Styles finished 30 minutes earlier than we estimated. That's not usually a good thing. He was done in 30 seconds. You could call him a one-pump chump. Hopefully, the patient will recover quickly as well. Looks like times have changed. The darkness within. That's concerning. You've Googled it, and they are different people, Derek and Styles. Yeah, see, I thought they got shipped together. That's why I was like, wait, am I thinking it's Derek Styles, or have I just seen Derek/Styles? Because his name is like Styles Stalinsky or something. I assume he has a first name. I don't know. I've never watched Teen Wolf. But I watched Supernatural at the same time Teen Wolf was like big in the Tumblr community, so like I had a lot of people who overlapped. Hey Tyler, you around? Where could he be? I didn't think we had any patients today. Is this a new thesis? I guess he still finds time for academics after all. Hi, Garden. Hi. Good to see you here. Your brother watched Teen Wolf? That's really funny for some reason. Oh, I don't know why I think that's funny. Dinner and Birb. Dinner and a Birb. Is it Birb for dinner? Not this Birb, but any kind of Birb. 'Cause I'll be honest, I may be a heartbeat, but I'm not against Burbs for dinner. Oh. Sorry about that. I just turned down, I was like, chicken thighs, hell yeah. I got some chicken thighs, if you know what I'm saying. If we go over here and we some chicken thighs. Some chicken thighs. Yeah. Anyway. Fried thighs, yay! Ooh, wifey licka emote. Good emote. Netherlands, Utrecht, euthanasia. Just the normal things you'd see in your doctor friend's report. Why would he keep a euthanasia thesis in his files? Oh, there's a letter. Thank you, doctor. Because of you, my husband finally found peace. What the? We'll bring that up at the next conference then. Crap, he's coming back. Where do I put these? Hey, what's happening, Derek? Need help with something? I wanted to ask about something. It rhymes with aphantasia. Oh, Takako's here. I showed you. You showed you guys that. How did you know? How did you know if I wasn't here? Or if you weren't here? It was. Oh right, medication. She was pinged about my thighs. Was she actually? I can pull up Discord. I can check these facts. I don't see it. But it's possible that Midve pung her. Pung her. Whoa, the pung yo. Thank you. You're not. Chat history. Takako show wo the pung yo. I think my tones are right on that. I took Mandarin once 10 years ago. They are athletic thighs. She uses them for being a strong girl. She can run. I cannot. But in harpy form, I am strong, athletic, and also my bones are hollow, so I'm very light, so I don't get winded so easily. Post-op medication. As far as I know, there hasn't been any. Oh, well, okay. If you don't know, then I'll just. Sorry to bother you. See you later, okay? Wait, Derek. I've been wanting to show you something. You would have found out about it sooner or later anyway. What? I swear I didn't read your files. Follow me. Recovery ward, room 305. Hey, Tyler. How are you doing, Amy? Not so good. Oh my god. Oh, sorry I made you get up. This is my sister Amy. She's been hospitalized here for 2 years. You mean she's infected with guilt? Yeah. Amy's condition is the reason I came here in the first place. Amy, this is Derek Stiles. He's an old friend of mine. He's going to be treating you, so go easy on him, okay? Okay. Oh, good nurse. Did you come to examine her again, Dr. Chase? Weird vibe. I don't like that. Thank you for the follow, Duke Shuffle. Leslie Sears, age 26. Sears! Leslie Sears! One of the many nurses on staff at Caduceus. She currently looks after several guilt patients, including Amy Chase. Nah, I just came to see how my little sis was holding up. Oh, I see. Amy hasn't been doing her homework lately. I was actually hoping you could talk to her about that. But it's so boring! Sis, if you slack off, then you'll end up dumb like your big brother. You want people to know how smart you are, don't you? Anyway, gotta run. I'll come visit again tomorrow, okay? You must be going through a lot, Tyler. Yeah, I guess it's payback for what I've been doing, huh? Huh? Look, dude, I know you saw my paper and the letter. I've been practicing euthanasia ever since I graduated. Why is he so chill about this? It's like, oh yeah, I've been doing a side hustle of euthanasia. That's my deep, dark secret. Yeah, this is... Remember when I said we might have a guy for you? I don't want to assume, but he is blonde and he does have a troubled past. But like, I'd heard rumors, but I never thought the Death Doctor could be someone like you. Why would you do that? One of the professors I had before we met died of cancer. Is he killing them all? Kill them all, Tyler! It was already too late when they found out. Professor Bonka. told them that. Himself. All he had left were a few weeks of suffering and painful treatments. Good people shouldn't have to go through that pain before they die. So I gave him the gift of a painless death. With my sword. Wouldn't it be so awesome if he was like, I'm the euthanasia doctor, but he actually just fucking stabs people? But that's... Of course people would prefer to live. It's only natural. But if everything causes pain and there's no chance of recovery, are you really living? No. You're just staying around so other people don't feel bad. Bad people, however, deserve to suffer in agony. That isn't true. I know it's naive, but I knew there might be consequences when I started. You probably think it's just suicide, or worse, murder. But things are different now. I want to be there for Amy. I am talking about AIM. If you're gonna turn me in, at least wait until Amy's gone, okay? You can't do that to Amy. I won't let you. ... She's been here 2 years. And he's just... I am talk about AIM. Something precious. We get Veftara. Veftara. Doctor, quickly! Amy's condition is getting worse. I'm crying about it. Her vitals dropped to the low 40s and she's losing consciousness. Just Tyler. The main guy is not killing people, but we found out our friend from med school is. But only people who are terminally ill. Excuse me. I wish I had a cute hiccup like Takako. What? Everyone, prepare for surgery. Angie, bring in the patient. I'll meet you in the OR. Hurry. Yes, sir. Tyler, this is an emergency. Come on, hurry. What are you doing? Let's go. You have a cute hiccup. You go, hic. It's cute. Cute what? You can't operate on her. What? I have to. Haven't you seen the pet? Yeah, it's a pet. It's a PET scan. Pet results? The guilt's already migrating. Her respiratory system's in trouble, and her digestive tract is next, dude. What are we supposed to do? Are you just gonna watch her die? Do you have any idea how many things we've tried? Oh, pickup? So I was like, I'll drive a car. Dr. Clark's couldn't help, and he's the best there is. All I could do is thin out some of the tumors. I just watch her get weaker, day by day. Euthanasia isn't poggers unless it's a legal adult. Amy doesn't have a lot of time left. What are we supposed to do? We're supposed to leave her alone so she doesn't have to suffer. Do you really think cutting her up even more is gonna do anything? They consistently put gonna and wanna, like, apostrophes at the end. I want to talk to the localization team. So what? You want us to watch guilt tear her apart? You don't get it! She doesn't need to go through all this suffering. Even if this operation helps, she might never open her eyes again. She'll just be connected to some machine, waiting to die. If that's the case, then I'd rather send her off myself. You call yourself a doctor! Slap! Called Maid? End of life program called Maid? Haha, cute! I'm Amy's brother before I'm a doctor. I'm supposed to watch my sister suffer because that's my job? I don't care if I lose my license. We am talking about AIM. What are you still doing here? Hurry up! I have to like pull back to do Angie because she's so aggressive. Make it in my life. I mean, ha ha ha, what? Dr. Clark's, we may not be able to operate. You don't understand, he has to kill his little sister. What? The guilt's in her lungs. It moved a lot faster than we expected. And I'm afraid she's not strong enough to survive surgery. What if we separate the operation into 2 procedures? No good. If we don't extract the guilt entirely, we'll end up right back where we started. Homo, I feel like most of your contributions today have been that emote, and I want you to know, based. That's a good emote and a good response. Now do you get it, Derek? This is how it always works. I always knew it would come down to something like this. I'll operate on her. She'll be okay if we can extract all of it, right? Leave her alone, you bastard! With the healing touch, it might be possible. Tyler! Amy! Tyler! Please! Do the operation! I know you heard us. Aren't you scared? No. I'll be fine. You worked so hard to become a doctor. I'm going to try hard too. I figured because it's in her lungs, she can't speak good. I'm glad you became a good doctor. Airing Fridays on ABC. That's I'm getting a little winded from doing that voice, actually. I'm getting dizzy. I thought I was doing what was best for Amy. But I was being a coward. I didn't even consider what she would want. Derek, can you handle this operation for me? I don't deserve to touch her. With these hands. These hands. I joined Caduceus so I could help people. What about you, Dr. Chase? Shouldn't we do everything we can if it could save a person's life? Yeah. Radical. Dr. Chase, please brief Dr. Stiles on the Deftera strain of guilt. Yeah, no problem. Hang on, sis. We'll be right back. He just shook that right off. I thought killing people was good, but now I see that it was bad. Yeah, see, my mom heard me saying it like a D instead of a modern Greek delta, which is a voiced TH. And she was just like, why are you saying Deftera? Why aren't you saying Deftera? And I was like, oh. His hands are rated E for eliminating my family. The Deftera is basically a tumor. A really gnarly one. I told you he was a surfer bro. This is the blonde doctor named Chase, in-house, who does commit an ethically dubious medical murder later in the seasons that I thought was really out of character given that he was religious. That's a true... I don't want to talk about House right now, actually. I'll talk too much about House. It'll happen for too long. It replicates its DNA while actively moving throughout the body. A tumor that moves? That's impossible. Well, to be fair, moving is kind of a bad description. It copies itself to other locations, so it just looks like it's moving. House Satsu is being added to the schedule. House 1977. So it keeps on replicating its DNA and creating new tumors. It's horrible. I know. Good news though, we might just know its weak point. What is it? Lasers. Deftera comes in 2 flavors. 51 flavors of mouse bites. We'll call them Type A and Type B. Type A and Type Bs like to eat each other when they meet up, but they're both kind of equally strong, so they'll just kind of stall there. And if they're not moving, they're just like any old tumor, right? So after we drain the gilt's tissue, we can just excise it. Takako, I need a voice pack of you being Angie, by the way. I need that. I need her eyes to be blue, and I need it to be you yelling at me every time I do a surgery. Hopefully, I mean, it's all theoretical. She's Sun as fuck, and she's hiding a dark past. Not a dark, she's hiding her past, and you're like, so why'd you come to Caduceus? And she's like, I was recommended. Do I need another reason? One wrong move and they multiply, so there's no room for trial and error. It's not like we could safely test the theory before trying it, but you have the healing touch. I've seen you use it, man. It's like Sugoi des. If anyone can save AIM now, I know it's you. I don't need to tell you the objective of this operation, do I? Remove the guilt from the patient's stomach and lungs. That's all. Just save her, man. All that stuff I said before, just forget it. Please, Derek. Suit up! I understand, Tyler.
Hurry, doctor.
This is really bad. We need to hurry. Yes, Takako. Oh, there's a cat hair on my screen. You pet your cat on BRB screen one time. Don't insult my intelligence, Derek. Burn them off with the laser. God, I love the laser. See, the big ones make the little ones, so you gotta get the big ones so they stop making the little ones. Continue with the tumors. No complications yet. My laser stopped working briefly. That was weird. Our data indicates the Deftera could appear at any time. When the Deftera combines to form a tumor, use the drain to remove them. That's the plan. Are you ready? There they are! And then they're gonna make tumors, and then they're gonna fuck. Oh, they're fucking! Okay. The Deftera settle down steadily. Oh my god, they love me. They love fucking. One more time, one more time, one more time. I got it, I got it, I got it. Yes! Oh my god, she's sick with it.
Doctor. Doctor.
Excision complete. You removed the guilt from her stomach. We'll move to the lungs next. First, finish treating those wounds. Hang on, let me... Oh, but if I wait too long, the bandage will fall off. The girl on the OR table is sick with it. That's true. Did they reset her vitals to 80 when I move on to the next operation? I feel like I have a memory of that. Or the next part, like when I open up her lung. You did it, Doctor! Amy's gonna be okay. It's a miracle. We'll move to the lungs next. We're counting on you, Dr. Stiles. Come on, Derek. Save my little sister. Please perform a lobectomy. Oh man, when they meet each other, they do bad shit. They like make a super tumor. It's like bad. It's not good. I would like those two to fuck, please. Okay, we'll just deal with this one completely first. Oh god. Oh, I'm so speedy. I'm so speedy. Who needs the fucking healing touch? Not me. It might be useful to use it just to, like, get her stats back up, but, like, just burn these little tumors. It's happening, it's happening, it's happening. It's like the yin-yang symbol from hell.
Well done.
The guilt has been eradicated. Chiral reaction is negative. The operation was successful. Good work, Doctor. Treat her other wounds and close her up. These tumors, I think it's weird that even though like the guilt has been removed, the tumors continue to multiply. I think that doesn't make a lot of sense. Thanks, Derek. Thank you so much. You're a real doctor, dude. I respect that. Radical. You ever hang 10 in the OR? Just put the dogs out. Amy should have a smooth and painless recovery. Derek, I owe you, man. How can I ever repay you for all of this? The idea of a doctor cutting someone open and a little pop-up saying, cool, is very disconcerting. I love it, actually. I think if we gamified being a doctor, it'd be sick as shit. VR surgery. Let's go! Let's go! Master surgeon? Homu could do it. Homu is always winning. Derek, it's up to you, man. If you want to turn me in, do it. I'll resign if that's what it takes. I don't care. I'm just glad Aim's okay. Thanks, Derek. Then, do me a favor. Huh? Re-edit that thesis you wrote, and donate it to Caduceus. You feeling okay, dude? Actually deserved us. I know, that went so well. They did so usually the ones of the same color can like run into each other and cause big like blow-ups that cause like the vitals to drop really bad. And that did not happen even once. It was crazy. Multiple assistants losing fingers. If your fingers are still in when I sew them up, that's your fingers gone now. It's fine. The body will eat it. It will use your flesh to heal itself. Tyler, you've always been good at writing detailed papers. Despite how you used the research, your thesis was no exception. Eliminating pain and suffering, facing death. Doctors and patients may be able to benefit from what you wrote. Surgery speedrun is insane. Hey, let me tell you something. The insurance companies that wanted to only pay for a certain amount of anesthesia based on the surgery that they thought was appropriate, that they wanted they wanted surgery speedruns. That's what they wanted. That's what they wanted. Find a way to use that information to save people's lives. That's all I ask. That's all I ask of you. No more talk of darkness. You got it, bro. Oh, there you are. Amy's going to be awake soon. Let's go check on her then. What do you think, big bro? Hey, don't call me that. Except in bed. You can call me that in bed. It's okay if you call me that in bed. International conference? Oh my god, this might actually be the bomb. If it's the bomb, we have to do it. Excuse me, sir, did you call for me? This operation is amazing. Your focused concentration is simply unbelievable. Is that the video of our guilt procedure the other day? I had my secretary transfer it to an HDV media card. What the fuck does that mean? High definition video? Maybe? I don't know. It's 2005. Watching this in slow motion actually reveals quite a bit. Did you have like a high-speed camera? Did you have a high-speed camera on me? Because you know, if you're only recording 30 frames, like no matter how much you slow it down, you'll only see the 30 frames. Like if I'm moving faster than that, well, you need more frames to do slow-mo. It's fine. Anyway, have a seat. There's an event I'd like you to attend. Okay. Oh my god, this guy. I love this boy. Hey, real fast. I need your signature for this. Victor, we're in the middle of a meeting. Yeah? Well, this'll only take like a second. Victor Nigel, age 26, head of the Caduceus Research Division. He's responsible for a lot of Caduceus' medical technology. Victor is like, yeah, he's such a fucking little curmudgeon. I love him. This is that petition we went over yesterday. There are no changes. Huh? Who's the new guy? This is Derek Stiles from Hope Hospital. He's hardly new. You need to get out of that laboratory more often. Oh, he's that healing touch guy. I'm Victor from R&D. How's it going? It's going well. Nice to meet you. How's this, Victor? Looks good to me. Okay, see you later. Sorry, Victor doesn't really observe manners. I apologize for the interruption. Let's discuss your trip. Head of a research organization is insane. Everybody in this game is like super young. Our international Sydney here, he's like head and he's like 35. It's like kind of ridiculous, actually. Our international conference will be held in Angeles Bay this month. Topics will be focused on the recent issue of medical terrorism. Dr. Stiles, I'd like you to attend as a representative of Caduceus USA. There's no way that any terrorism could happen at this conference about terrorism. Emil Tanuki, thank you for the follow. I'd also like you to speak about the strains of guilt you've operated on and the procedures involved. Can you do that? Your guys mixed up speedrun surgeon was early 1800s and amputated someone's leg in 2.5 minutes? Without a high-powered saw? Was he fucking, what's the guy? He's a fate servant, giant lumberjack man. Paul Bunyan. Was he Paul Bunyan? Was he like that strong? Ooh, you got a cute little, yeah, Paul Bunyan. Ooh, I like your emotes, so cute. I really liked the idea of Paul Bunyan just being a giant small child. I think Fate kind of cooked with that one, if I'm honest. That was like pretty good. Thank you. Okay, that's a little disconcerting, but you know what? I still fuck with it. Don't ask how many. Well, in the 1800s, surgery was very risky no matter what you did. So, like, they made a magic card of Paul Bunyan? Midva, is this true? Midva, can you confirm? What does it do? You know, all magic cards. That's what I've been led to believe. Yeah, once you got to amputation, your risk was, like, super high. Doing it fast was probably good, but, like, I don't know. Anyway, on to the procedures involved. Okay, well, I haven't really been here that long. I'm sure some of the others could do a better job. We're also showing footage of your operations. I'd prefer that you were there to explain the surgeries step by step. She makes a blue ox token? Ooh. Why is it blue? Oh, I'm an idiot, actually. It's a blue creature. I was like, why the ox gotta be blue, though? Dr. Myers will be going, so I'll ask you, this is the bomb, to translate for you as well. Have fun, Derek. How many languages does Dr. Myers speak? Angeles Bay Conference Center. Once again, that was Dr. Styles of Caduceus, USA. I'm glad that's over. Thank you for your help, Dr. Myers. No problem. I think the video footage really got their attention. You could have loosened up a little bit out there, though. You've never spoken to a big group like that, have you? I'm usually too busy just helping patients. Bonnie Paul Clearcutter. I want to see her. I want to see. Ooh, that's kind of cool. Create bow. A legendary blue ox token with bow's power and toughness are equal to the number of lands you control. That's kind of goated. It's expensive as hell, but that's really good, actually. I don't know. It might be too expensive to be good. It's a 6/5, though. I don't know. I don't know about the meta. Blue Ox White token. Thank you for the follow Forest boxes. You remember seeing it in an up-and-coming Game Informer many years ago? Yeah, it feels like... I don't want to say it feels like yesterday, but it feels like a couple of years ago, I feel like. And then I'm like, oh, this game came out 20 years ago. That's not unhinged in any way, shape, or form. That's not weird. That's fine. Even if I had time for meetings, I'd fall asleep. So yeah, that was my first presentation. Yeah, a lot of what was I doing for her? Yeah, a lot of doctors are that way. But you should still schedule time to attend conferences. It's the only way to keep up on the latest technology. Technology, you know? Being a doctor is like being a lifelong student. Dr. Casal used to say the same thing. All doctors are students. Good old Greg, huh? Now he was one heck of a public speaker. He was confident, threw in some jokes, never had stage fright. I remember staying up all night helping him make slides. Is that all you were doing? Never mind. That's all in the past now anyway. Sounds like you guys were close. It wasn't like that. He was a great guy, so I always did what I could to help out. Really? What's that supposed to mean? Hear that? I think they're starting the next presentation. That concludes the disease treatment workshop. Next, we'll have an update on the fight against medical terrorism. Please report any mysterious packages standing around. Speaking on this topic is Langston Miller, Chief of Caduceus Europe. I received this report a few hours ago. I hope it finds you well. Who would be calling me at a time like this? Nobody. Spam. I forgot to silence my phone because nobody ever fucking calls me. As we all know, medical terrorism poses a serious threat to all people in the world today. Disease reports have doubled in the past year alone. Unfortunately, the motivation behind this epidemic is still unknown. He does look like an SMT villain. That's true. Why are they calling a... Oh. Hi, Takako. Takako called me. Okay, bye, Takako. But we have received information that the group responsible calls themselves Delphi. does have a lot of pins. He's military. Delphi. Like the Greek oracle? The messages we've received from them have been cryptic at best. Their philosophy and demands are still a mystery. Are they related to other terrorist cells? We're not sure. For all we know, they could be a fanatical cult. But whoever they are, we know that they're hostile and organized. We believe there may be additional clues hidden in the strange letters that arrived shortly before each guild operation. We received one of those. Medicine has advanced quickly since the advent of genetic engineering. School background looks like it belongs in the 10 dogs. Oh my god, it does! Oh my god, little puppy symposium. But, as Guild has shown us, disease can evolve just as fast. The ramifications of medical terrorism are grave indeed. And it's going to take our best minds to find a way to stop it. So we may finally have some way for them to start looking. We've received news of an abandoned Delphi research facility. It seems they entered a small African village, possibly posing as the MPO. I'm afraid they were using the townspeople to develop guild. Bastards. Little puppy symposium. The town was destroyed and the facility was abandoned, but I'm sure there's something there that might lead us to Delphi. I propose that I did not know I was going to have to do this accent for this long, if I'm honest. I propose that Caduceus send a research team to Africa. Supplies and manpower will need to be approved by each division. I hope to have your cooperation. Oh, thank God. Man, talk about long speeches! You and me both, brother. Well, a lot happened over the last year, so I was expecting that. I will not enjoy writing this summary report, though. Huh? The lights! What happened? What's going on here? The shutters are dropping. Is there a fire? Why would they lock you in if there was a fire, Derek? You doctors and your temporary cures are worthless. If you would all just die, maybe people could finally stop living. Wow, that's a weird take. What the hell? What is this thing? Don't! It's a bomb! There's a bomb! Bomb? Come on, Sybil. We have to get out of here. Damn it, there's no way out. We're going to die. Somebody help us. Sounds like it's over here. Follow me, Dr. Stiles. What? But that's where the bomb is! That's the point. What are you going to do? We have to run. There's nowhere to go, but I told you to follow me. I cut out of the my fucking compressor is killing me, dude. It does not love me. Hang on, one sec. We got this. She's got this. She's killing it. Okay. It's been better. But, okay. I told you to follow me. If you're going to die anyway, what difference does it make? Be a man. Jesus. It's sexist. Yes, ma'am. You're going to dismantle the bomb. I'll be your assistant. What? I can't do that. So you'd rather do nothing? Are you going to sit here and cry for help like everyone else? Screw that. If this doesn't work, at least we can say we tried. Yes, Mommy. Sorry, Mommy. If you would die, you'd stop being alive. How is that not Shiro? Shiro runs Delphi. Get it in the books. I'm ready. Give us some room. Set up a barricade with the desks and tables. Everyone take cover. Oh, actually, that probably wasn't my compressor. It was probably because it was high-pitched. It's probably the noise suppressing. I might have to take the noise suppressor off. It's a bomb. Blindly cutting at it would be extremely bad. Type time bomb. Thank you for the follow, Paradoxus 2021. I think everyone's clear enough. Oh, I clicked on the top screen like a fucking idiot. Okay, you'll need to follow my instructions carefully. Got it? Aren't you scared? Of course. But why should a doctor be afraid? I'm sure you've been in worse situations than this. We hold patients' lives in the palms of our hands, you know. Thousands on board, he holds their lives in the palm. I changed into my favorite things. I was trying to do Titanic. One mistake and you have to watch them die. What could be more frightening than that? I guess a bomb? You're brave, Dr. Myers. Ha! They don't call me the Iron Vixen for nothing. That's what Tyler said. He comes up with some weird nicknames. Actually, that started back during my days on the police force. I was in the crime lab, you know. Even though I was just a novice investigator, I was still stronger than all the guys. I stored my power in the breasts. So, you were really a police officer? I mean, in surgery, one person might die. With a bomb, like hundreds? And maybe me? That's right. And I dated a guy on the bomb squad. So, trust me on this one. I made him read me his textbooks in bed. Okay then, let's begin dismantling the bomb. Oh, it looks ugly. This bomb design is archaic. The trigger device is a pair of small water tanks. We'll need to find a way to deal with those tanks before moving on. Dismantling it shouldn't be too hard. Well, it's possible anyway. We shouldn't waste any more time. Let's get down to business to defeat the Huns. That's a good idea. We need to magnify this for precision. Okay, let's check this guy out. Magnify the lower right water tank. This is a trigger device. If it detects a change in the water level, the bomb explodes. This gimmick's been around since ancient Rome. It's also a timer. See, the water flows slowly from left to right. When the left tank empties and the right one's full, it explodes. We may be able to work with a drain here. I cut it off before she... Now move to the left tank and release the water. Why can I not simply suck out all the water? The water level is constantly changing. Keep an eye on it. So that takes care of the trigger. Let's move on to the explosive. Stop magnification. We can see the entire bomb. Those brown rods are dynamite. Ayo. They won't explode on their own. I assume those silver boxes are supposed to ignite the explosives. They're not operating right now. Either they failed or it's a trap. But if that changes, it could cause the dynamite to explode. Let's take care of the dynamite before that can happen. Magnify the area. You got it, babe. Oh my god, I suck. Okay, let's begin. See that yellow part at the end of the dynamite? That's the detonator. Basically, if the detonator's gone, the dynamite shouldn't explode. If we disable the explosives, then the igniter is probably useless. So we just need to pull out the detonator on each stick of dynamite. Dynamite is actually famously very stable when it's in good condition, so this shouldn't be too scary. That's how to dismantle this bomb. That's not so bad, right? Try pulling the detonators upward with your forceps. Okay. She said good job. This is bad. The trigger device has been activated. When the temperature level hits max, the explosive will go off. I thought you told me to do this so that didn't happen. I think you can lower its temperature by using the gel, but we have to shut it off somehow. Where's it being controlled from? I still need to remove all the pins, right? Oh! Pull the detonator upwards. Now to handle the trigger device. Get triggered, idiot. Oh. We have to shut it down. Something has to be controlling it. What about these microchips? This is probably related to the trigger device underneath it. If we destroy the microchips, then their trigger should deactivate. Follow that pattern. Destroy only the chips that are connected below. Okay, so this blue one... It should be this one? I was wrong! Everybody, I was wrong. Alright. I used to have it memorized which ones you needed to do, and I would just do them. That didn't happen. That was a different timeline. Send the D-mail.
Ready to go?
Send the D-mail that says, don't pull that chip. Derek. Oh, the green ones, I don't... Okay. I did pull up. It's a shitty tablet touchscreen. It's like a Galaxy Tab A. Why does the Birb kill the hot Dr. Cop? She is a cop. And a cab. But she's not a cop anymore. Also, I killed, like, at least, like, 50 other people. So, like, why you gotta focus on her? Okay. Oh my god. Jesus Christ. Jesus. There we go. Okay. So this green one is definitely connected, and it goes like this. Here? Okay. And then... What other ones are connected? Okay, we'll just... Okay, a red one. We need to cut a red wire. Something connected to... There's 2 red wires, so both reds need to be burned. And this red goes here.
Good job.
And this red goes here.
Good job.
Okay, let's go back here and check on the tanks. Oh, the dynamite's been nullified. Never mind, we don't have to do that. Temperature's too high. Oh god, I'm sorry. Please don't yell at me. Hot mommy. I'm sorry. It's a good thing we keep this at a cold temperature. Okay, blue and yellow. Blue is here.
Good job.
And it's this yellow, and it comes around and it's here.
Good job.
Okay. Trigger devices are dismantled.
Derek.
Cut the red... Okay. I want to take my time. That didn't help. Why did the healing touch not slow down time in this specific instance? I did it. Whew! It'll be too wet to be creepy, that's right.
That worked out.
Talk about your bad patience. Whew! Whew! Goodbye, 2021 to 2023. It was a good run. I'm a specialist, baby. Ugh, I'm dizzy. I can't feel my hands. At least we're alive, right? It's better than dying anyway, any day. Of course, I knew we'd be fine. It was just a bomb. No big deal. Baby bitch. The Iron Vixen, huh? I think I get it now. The lights are coming back on. We should tell the others it's okay. How do they know? How did they know to turn the lights back on? Are the waist wings on the Birb model fluffy feather wings? Or like tattoo waist wings? So my wings on my arms are fluffy feathers. Hang on. Oh, these guys? These are feathers. Yeah, so the feathers go up my rib cage and sort of onto my chest a little bit. And then they also like meet up on like my scapula on my back. They're feathers. They're just feathers on my tummies. They're not wings themselves. They're just like rib cage feathers. Good to know, good to know. Back to this. Okay, we stopped the bomb, everyone. It's all clear now. Thank God. I thought I was gonna die. We're alive! Great job there, Styles. You definitely learned from Greg. Same to you, Dr. Myers. You're pretty tough. Woohoo! I can't believe it! Let's hear it for Dr. Styles. I think we found the perfect man for the Africa mission! Oh, German's going into Africa. I don't know that I like that anymore. ありがとう。どういたしまして。誰も言わないけど。Alright, I think we're gonna finish up this chapter, and then we're probably gonna call it. Footfalls of Terror. We received a letter of thanks from the conference directors. I was worried when I heard about the attack. I'm glad you're both safe. It's all thanks to Dr. Myers. Huh, she's definitely the toughest woman in medicine today. You should ask about some of her adventures on the police force. Ah, Chief. Derek's gonna take you seriously. He'd have good reason to. Oh, that's right. There was one other letter I received. Dr. Stiles, Caduceus International has requested your presence as part of the research team headed to the Delphi facility in Africa. This is one of my favorite missions. They asked for me? That seems like a mistake. I agree, we blew up the bomb the first time. Don't be modest. We've all seen your amazing skill. You have experience treating guilt, and you defused a bomb. Langston Miller, director of Caduceus Europe, was very impressed. And the rest of the committee voted unanimously. You should be proud. Yeah, but I've never left the country before. I don't even have a passport. Are you gonna pay to expedite that? Because I'm not gonna pay to expedite that. Well, you don't have much choice. I've already accepted the offer. Give it up, Stiles. Once he decides on something, there's no arguing. Getting haircut? Good luck, Nano. You're gonna look so fucking sick. Looks like you're going to Africa. I didn't realize he could be that stubborn. I guess he's always been difficult. That's what Greg said anyway. I remember him talking about the arguments they get into as kids. The only reason Sydney went to school overseas is supposedly because everyone told him not to. Dr. Casal could be stubborn sometimes, but not like that. At any rate, have fun in Africa. As long as your partner's reliable, I think you'll be fine. Partner? Saved the game? Oh, we on plane? Oh, I remember this. Miracle at 9,800 feet. International Flight 326. Destination? Just Africa. Rabora's far away. I mean, 3 transfers and 33 hours of total travel time? Wow. At least you're used to it. I've never even been to Mexico, and I don't like flying. Remember to drink plenty of fluids and get up to stretch your legs. We did that a little while ago. It wouldn't look very good for a doctor to get sent to the hospital. It'll be hot in Africa too. Try not to get heat stroke. I hope getting vaccinated for the endemic diseases was enough. Attention, please. Is there a doctor on the plane? I repeat, are there any doctors on this flight? One of the passengers is sick. We don't know how to treat him. If you have medical training, please notify a flight attendant. Doctor! I guess I won't be sleeping on the plane. It looks like respiratory failure. From what his wife explained, he'd suffered from edema of the lungs. He was prescribed medication which stabilized the condition. They were given permission to return home. But stress from traveling may have aggravated his symptoms. Yeah, good thing we travel in scrubs. I'd recommend an immediate lobectomy to drain the pleural fluids. There's how many fluids? We're going to perform surgery in mid-flight? The captain has allowed us use of the crew's cabin. Sterilized gowns and operation tools have been prepared as well. Yeah, you cannot sterilize a fucking airplane. I don't believe you. We really don't have a choice. Once we land, he can receive more permanent treatment. I did go full chimkin. But for now, we have one objective. Drain pleural fluid from inside the patient's lungs. Use ultrasound to find where fluid is collected and drain it. Understood. Let's hurry. Let's begin the emergency operation. Unfortunately, Doctor, there's a storm up ahead. They're going to try to avoid as much turbulence as possible, but this is far from an ideal operating environment. Try not to let the shaking of the plane distract you, Dr. Stiles. Ha! Cool. Why do I just carry it? It's my pocket ultrasound machine. We are going for like a medical mission. I don't know why it wouldn't be checked. That is a good question. Respiratory failure is serious. We need to finish this quickly. Try using the ultrasound to locate... Oh. Perfect. Blue? Why? Nothing in you should be this blue. Drain it immediately before we hit more turbulence. We haven't hit any yet. Chill out. Oh, it's turbulence. I hope it settles down soon. Okay. We know that's there. Eek! It's stabilized. If the plane starts shaking again, it could... Yeah, I get it. Okay, so I have to wait because... Oh, drink everything, and then it's Baba Bast. Because if he's shaking while if his fluid's exposed while shaking, it will cause these little, like... I don't remember what they are, but they're not fun. It's easier if you just wait. So we locate the next bit. Oh my god. Blue icy. Blue raspberry icy desu. It's like here? Yeah. Who needs an ultrasound? Half complete? I don't know how you can tell. Oh my god. Oh. Hello, American Expressy. What a cute little emote. Oh, I didn't mean to do that. Another wound. You need to suture it. Yeah, I didn't mean to. I was just prepping my needle. Oh my god. Surgery is famously vibes-based. That's true. They're ruining the vibe. Now, they were down here? Well, they probably get moved around every time he gets... Oh god, we gotta drain these fast. They really want to fuck me over. We wait. Okay, no, we can do this. We're fast enough. Where's the next one? Oh my god. This is like the girl with the heart arrhythmia. Like, could you not for 2 seconds so that I can get this fluid out of your lungs? The patient's breathing is stabilized. He should be okay for now. Let's finish up the treatment.
Nice work.
I guess we did it. Oh, they're applauding. Don't let it go to your head, Dr. Stiles. I love her angry face. I love it. Bum, 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 bum. B. I'll take it. I think he'll be okay. I contacted a hospital near Rabora. We can take him there once we land. Doctors are really on call 24/7, aren't they? B for Birb! I'm a burbcialist. Burb specialist. Burbcialist. Remains of Rabora, Africa. We're finally here! The sky's so clear. Breathe in that air. And it's deserted. I think we're looking at the results of a guilt outbreak. Oh, I wish we weren't so far away from home. You seemed happy like 10 seconds ago. Angie, you're hot and cold. Hey, don't talk like that. Over here! Who's that? It's nice to finally meet you, Dr. Stiles. I don't know where this accent is going anymore. Oh, Dr. Miller, sir. This is Langston Miller from Caduceus, Europe. Ah, he's the one who assigned you to this mission. I was getting worried. You're a little late. What? That one's Scottish. Well, one of our coordinators is sick, and we don't know exactly where the research lab is. There's been a lot to worry about. Sir, I have an update. We searched sectors B2 through 4, but could not locate the target. Continue your search into the sea areas as well. Yes, sir. The jungle makes a bird's eye search impossible. We tried to narrow it down back home, but we still have a lot of ground to cover. Must be frustrating. I have a bad feeling about this. Why don't you help us search? Report back if you find anything. Here's a map of the area. We've sent teams out here and here. What kind of map is this? It's just written directions. Well, let's get started, I guess. 6 long hours later. Are you all right, miss? I'm glad we can drive, but this Jeep sure is a puppy ride. Well, the area is not paved, but it's better than over in the jungle. It's been a long time. Let's head back to camp for a breather. I mean, huh? Stop the Jeep. There's someone in that house. It's a child. I thought they said the area was abandoned. 1 hour after that, the boy answers to Ruben. We think. Nice to meet you, Ruben. Mm-hmm. What was he doing in there? We think he used to live there. His family is in a nearby town now. Shouldn't we take him there? Perhaps, but the boy seems to know the location of the research lab. Apparently, his brother worked there, and Ruben used to tag along. We might as well have him take us and see it, don't you think? Ah! That'd be great. Thank you, Ruben. Ah! Abandoned Delphi Research Lab. As we thought, it's completely vacant. What are we supposed to find here? Let me take some samples from the walls and floor, just in case. Thank you, young lady. We'll need to disinfect our entire bodies after this, but hopefully it will prove worthwhile. He goes, It's too dangerous for you. Could you wait outside? Mm-hmm. There's a good lad. I hope this is worth all the trouble. Back from dishes. Good job doing the dishes! I'm terrible at doing the dishes, so I praise you highly for doing a good job of doing care tasks for yourself. Oh god. I didn't think this mission was gonna be now, but I guess this is how we close out chapter 3, so after all that, we still don't know anything about Delphi. They transferred the African guilt victims to Caduceus Europe, right? Hopefully they'll know something. Yeah, but this was all so tiring. Dr. Miller is late. I wonder who was calling on the radio. Dr. Stiles? What is it? The boy, Ruben's been infected by guilt. What? How? This is Treaty. Tuesday. The third one. The boy's chiral results just came back. He tested positive for guilt. The spectral analysis indicates this is a different strain. An unknown guilt. We found an abnormality near his pancreas, but that's all. This is a sick-ass operation. Everybody hang on to your fucking butts. His vitals are dropping quickly. If we tried to reach a hospital, he would probably die on the way. I think we should open him up and do what we can, but it's your call, Dr. Stiles. The guilt is not in his ass, the guilt's in your ass. Hold your ass. The guilt's in his pancreas. I understand. We can't just stand here and watch him die. I'll do my best.
Let's begin.
We've never dealt with guilt like this before, so be careful. Cool. Oh, it is a sick ass, yeah. What the heck? A membrane? And these look like thorns. Could they have known about? What is it, Dr. Miller? Stiles, I think the membrane is causing the disease. Any organ covered by that membrane will be slowly petrified. Oh, so it's like when my gallbladder turned into a rock. We need to detach it immediately. Use the scalpel. That won't work. Thank you. You won't be able to detach it that way. Don't you see those thorns? They've fastened the membrane to the organ. I think you're right. We need to, if we remove all 3 thorns of one segment, there's a chance we could excise it. That's quick thinking, Angie. You should consider Caduceus Europe. Anyway, try pulling the thorns out with your forceps. Okay, so that purple bit, that's bad. What we want is to do multiple segments at once, and that purple bit's our worst bit, because it, like... We gotta act fast before they grow back. Yep, there it goes. The membrane is expanding, you can't grab it. A while ago, our country tried using similar technology to fight organs that had become cancerous, shards which vibrate at high frequencies to stabilize the cancer tissue for removal. It creates a hardened membrane exactly like this one. This strain of guilt seems to be modeled after our treatment. Those thorns are releasing frequencies to petrify the organ. Dr. Stiles, we need to try removing them all at once. There has to be some pattern to it. Keep an eye on the membranes. The pattern is, if they can complete the triangle, they will. Okay, so we... And then we just get as much of it as we can. Okay, so some of it regrew. That's fine.
Doctor,
Nope, we don't like that. All right, and then, chat, what we do is we cheat. Oh my god, we cheated and it still happened. I don't think the healing touch is working well in this emulator. I think this is a little busted, if I'm honest. But other than that, everything seems to be fine. We got it. We got it. Chiral reaction is negative. Sir, you were surprised that they knew about something. I'm afraid this guilt was derived from one of my country's sins. As I said earlier, we were trying to create a treatment for cancer using high-frequency vibrations, but there were complications. Our treatment couldn't differentiate between cancerous cells and healthy ones, so it simply attacked them all. We wanted a way to help people, but we found a way to kill them. And apparently Delphi found out about it. That is what I meant. Let's close up the patient now. Ruben should be fine now. Yeah, that didn't go quite as poggers as I had hoped. I used to be kind of sick at this operation. But impressive, Dr. Stiles. It seems that guilt is no match for you. That's right. I can't have guilt. I have no guilt. Guilt-free baby. Oh, that's why I paid for therapy. I'd say you've more than earned your place in Caduceus. Welcome back, Nano. I think we're getting ready to wrap up. Because I think this is the end of Chapter 10. Chapter 10, Chapter 3. And I've been going for a bit now, and it's a Sunday, and yeah, that's fair. Chad, I have to tell you... I have to tell you... Oh, Ruben! He's okay! Ruben! Try not to move. You're going to be all right. Your mother just arrived. Get better soon, okay? Dr. Miller might be able to send him to England for treatment. Maybe we should ask him. He's English? He's English? What have I been doing this whole time? Oh my god! Oh no! Maybe Caduceus Europe is just headed in England. That wouldn't make any sense. But I just thought he looked kind of German. There's a Red Cross outpost in the next town. We should at least have them look after Ruben. Ah, a gift for us? But isn't this your book? Should we take it, Dr. Stiles? It seems important to him. Huh? Wait, this isn't a book. It's a file folder. It looks encoded, but what's this say? Guilt! Guilt, this is... His brother must have given it to him. Thank you, Ruben. This is going to save a lot of people. Ah! Dr. Stiles! There you are. He's staying German. I've committed at this point. Dr. Miller, we have good news. Miller is such an English last name, too. What am I doing? Oh my god. I just thought, I thought like a big medical organization would be in Germany, that like in continental Europe. That just makes more sense to me. So like, that can wait. We just received an urgent telegram from America. He's really almost sounds more Swedish than he sounds German. Urgent, I wonder. No way. What's wrong? Dr. Casal from Hope Hospital was just admitted to Caduceus. Caduceus? Don't tell me Dr. Casal's been infected by a new strain of guilt. It's called Wednesday. All right. Ladies and germs. And therms. Thermal sweater. Sparkle on me, nah. It's Wednesday, my dudes. It's Wednesday! And maybe even Thursday. So I'm gonna wrap up because I am hungry. That's the thing I was gonna tell you that I'm not supposed to tell you, is that I actually only had 2 graham crackers today. But let's see who is on. Is Ruri streaming? I know she was talking about it. Hungry? I thought I wasn't Burp. Let's see how hungry the stream says I am. I'm 60. Hell yeah, nice.